So Aarti, where are you these days?
Hey Kita, so I'm in Wisconsin now in Marshfield Hospital. So I'm working there as an associate physician.
Right.
Yeah.
Marshfield is where? Which part of the US is it?
Hello.
Can you hear me? Hello? Can you hear me?
You. We can hear you.
Okay. Okay. So where in the US is it, Aarti? I think she can't hear me.
Yeah, she got disconnected, I think.
Oh, okay.
Did you meet Dr. Rui? He has joined.
Yeah.
Hi, Krishnamurti. How are you?
I am good, Rui. How are you?
I'm
Thanks
well.
for coming in early morning on a Saturday.
Oh, it's my pleasure. I was up already anyway.
Okay. How are things?
Things are coming along well. Yeah. How about
Okay.
you?
It's quite good here now. Getting back to normal, more or less.
Okay.
We are just keeping our fingers crossed that we don't have another, nasty wave. But as of now, it's good. Vaccination's gone on very rapidly now, and we have very, very few cases happening, and otherwise okay. Yeah.
That's nice. That's nice. Is Sanjeev on his way to Nashville?
So yeah, he's in Mexico, supposedly doing his quarantine, but he's roaming around the country. Yeah.
Is
so
he with Martinez?
I think so, but I think he and Archana are traveling around. So they were in Mexico City and somewhere else, and they're planning to go to Cancun as well. So yeah.
Nice. Tough
Yeah.
life.
So very tough life. 2 weeks of quarantine in Mexico. Yeah. So he has a meeting next week, right? In the AOMS. Yeah. Are you attending the AOMS?
Yeah, I'll see him over there.
Okay. I believe in Nashville, there's a lot of cases.
I think there are, but the numbers are going down. Certainly in Florida and everywhere else, I believe they're going down. So
okay, that's good.
That's a good thing.
And how is work?
Work is work.
Good.
Same.
Yeah, good. Our book had about 1.3 million downloads now, Rui.
Wow.
Yeah.
That's amazing.
Yeah. So
Congratulations.
download. Yeah. And download from everywhere in the world. Yeah. I think keeping it as open source worked to our benefit. Yeah. People could access it, or they're able to access it without having to pay for it.
Yeah.
Thank you very much for your contribution.
Oh,
I didn't get a chance to thank you.
It's my pleasure. Thanks for inviting me. It was a brilliant idea to make it open source.
Yes, this suggestion came from our publisher Springer, and we grabbed it because we realized that this is an invitation for everybody to read, and anywhere in the world, except if you can't read English. That's the only drawback of that. Otherwise, it has downloads from everywhere.
It's a very good, you're right, it's a very good source of correct information for a lot of people who wish to.
Yeah.
I see a lot of people approaching us also. Yeah.
That's right.
Yeah.
So Aarti has come back.
Okay. Sorry, I just got messed out in between.
Yeah. So where did you say you work, Aarti?
I'm in Marshfield in Wisconsin.
Okay.
So Marshfield System of Hospitals.
Okay.
So we see a lot of
Sandhya has not joined, right?
I can see Sandhya's name. I can see Sandhya's name already. Yeah. There is a Sandhya. I can see Sandhya. Who's the other person you said?
Mahidul.
Yeah, I saw that name.
And then
also.
Preetam and Kanan both have.
Shahidul, right? Shahidul is also there.
Yeah, Wahidul.
Wahidul, no. Shahidul is there.
Sandhya is there, yeah.
Yeah.
Wahidul, oh, no. Can we wait for some more time till we have
Yeah.
some more people? And I
Yeah.
just.
Yeah.
Mhm.
We'll wait for 5 minutes and then Saturday evening, Saturday morning for people.
Yes, I
Yeah.
know. I totally get that.
Sorry for all the interruptions. I think the internet was a little unstable in between. Hey, Dr. Fernandez, how are you?
I'm well. How are you?
Good, good. Nice to see you. I think we met in a couple of meetings before.
Yeah. Yeah. You
Yeah.
enjoying Wisconsin?
Yeah, it's good. It's a good mix of surgical wise. I'm really happy about it. It's kind of a little smaller town, a smaller city kind of place. So it's not bad. It's closer to Chicago. It's around 2 hours from Chicago and 2 hours from Madison. So it's not bad. Yeah.
Nice, nice. Are you getting ready for the cold weather?
Yeah. It's like a switch. It was like beautiful weather, gorgeous spring and summer, and all of summer is just like such short-lived time. And even before we know it, we're already in fall and the colors change up. But
the
haven't
Florida,
seen such beautiful fall anytime before though.
the Floridan is mocking you.
Yeah. Florida. I know all
Yeah.
the time.
Yeah.
But that's what we do. In winter,
Yeah.
what do? We travel to Florida.
Right. Right.
We snowbird.
Right. I believe a whole lot of people from Indian origin have retirement homes there, I'm told, in Florida,
Yeah.
because it's
Yeah.
sunny.
It's a gorgeous place in Florida. Yeah.
Mm.
Yeah.
So do you come to India sometimes, Aarti? Aarti's frozen again.
So my plan was to come in for the December conference, but
Okay, to Mangalore.
is it?
Yeah. Yeah. Yeah, it's supposed to be happening
Plan
now.
was to
There's
come
some
in
movement.
December.
Right.
Right. But it's been 8 years actually. Every time I decide to come in, there's
Oh.
something other stops it in between.
Oh.
Now the COVID came in between just after my graduation. So I was hoping to come in December, but I
Right.
don't think that would work. So probably sometime by May, I'm planning to
Okay.
visit India. Yeah.
Okay. Good for you. We also have the travel bans coming off slowly. So the travel ban
November,
to the
right?
US is gone. Yeah. November.
Yeah.
There are some
so that's
issues
good.
with UK with our vaccination certificates. I think that will get sorted out soon.
Okay, that's great. Yeah. The online conferences are great, but really missing the
Yes, it's gone on for too long now.
part of it, the social
Yeah.
part that's really gone out of our
Right.
realm. So
Right.
it'd be nice to get back to that.
Yes.
Yeah.
Yeah.
Getting I think let's start. Good evening, everyone. It's a pleasure and an honor to have you all here with me today. The whole idea of this session was actually through a attendee of mine, couple of attendees of mine who really wanted a session where they could get a direction on what are their options after post-graduation. Now, a little bit of the history. When we did our post-graduation in the year 2000, that was early 2000. And that was the time when we came out, and obviously in post-graduation, what happens is that there's a lot of observations and assisting, but we're not as confident about operating independently. It's like swimming in a very closed pond with a lot of floaters around, and suddenly if you're pushed into a sea or ocean of surgeries and made to swim through and find your way, I think that's a very difficult task for anyone, whether it was 20 years back or now. But at that time, when we wanted to do fellowships, it was not something that we had an option. We really had to know somebody personally, or somebody had to know us to come in, or we had to look for job options where we could job options in good centers. Now, job options in good centers was another problem which not everybody had an access to, especially for women. You were always dependent on location of your parents or your husband, or your future husband. So these were the reasons why we were stuck. But fellowships have opened a huge arena for a lot of people to live their dreams, chase the dreams, and that is the reason why I think the current generation is extremely fortunate to have this for them. And this is the reason why I think this session means a lot. But is the fellowship end of the story or a beginning of a new story? This is what we need to find out through this session. I mean, it should not appear as if once you have done your fellowship, then the whole world is at your feet and you can just you do whatever you want. I don't think that, I think that's also a wrong perception. It's a milestone, it's a big milestone in a career of any maxillofacial surgeon or any surgeon for that matter. And what happens next is something that we all have to carve our own niche, find our own way, with the help of the mentors which we meet on our way. So with this little bit of background, I would like to invite you all and thank you all, welcome you all on this forum. And I hope that you will enjoy this session and appreciate work that has gone behind this. The time that our mentors and mentees are going to be spending with us, I hope you find it worthwhile. I would like to now invite our first speaker for this session, Dr. Rui Fernandez. Dr. Rui Fernandez it's an honor to have Dr. Rui Fernandez here with us today, who will be guiding us on the International Association of Oral and Maxillofacial Surgeons and what are the options of fellowships which International Association offers the world. As the session name goes, the session will give you an overview on the world perspective as well as the Indian perspective. Dr. Fernandez is a very well known in the field of oral and maxillofacial surgery world over. He's a board certified oral and maxillofacial surgeon with qualifications in head and neck oncology, microvascular surgery, and is a member of American Board of Oral and Maxillofacial Surgery. He is a professor and professor of surgery at the University of Florida College of Medicine, Jacksonville, holds various appointments in departments of oral and maxillofacial surgery, neurosurgery, orthopedic surgery. And you can see on this slide, there's so many, it's an absolute honor to have Dr. Rui with us today. Let's all welcome Dr. Rui Fernandez. Welcome, sir.
Thank you.
The forum is yours. Yeah.
Thank you very much. Really appreciate the opportunity to spend time. Is it possible for me to share my screen?
Yes, sir.
Okay, perfect. Just sorry, I have lots of things open. So hopefully you guys can see the screen. So when Dr. Kaur asked me about this program, and particularly the idea was to share some perspective with regards to what it takes to successfully match into a fellowship. What are the opportunities, both from a IOMS perspective, but also from obviously I can speak a bit to the opportunities within the United States as well, and to an extent, what comes about, or how does one think about fellowship opportunities and how you go about securing one. With anything or with everything, you have to start with that question. Well, why do I want to do it? And I think many of us either start the residency program, we choose the path that we want to go. In this case, we choose maxillofacial. And it's usually because the specialty as a whole attracts us. And then when you embark on that process, you find that maybe a particular area attracts you more than all the other bits. And the intent of fellowship is that you're going to choose that particular subset because it is one that you're passionate about. It is one that you want to focus your career upon. And it's one that you see yourself sort of best fit for to have a fulfilled academic or private practice. So as you begin to approach the end of your residency program, you have to think about, how do I best position myself to secure the fellowship if that is the path that I wish to go? So to begin with, you have to think about, well, is the subspecialty area mandates or heavily encourages the pursuit of a fellowship. Things like cosmetic surgery, head and neck oncology, microvascular, cleft lip and palate, craniofacial. Those things, I think, especially if you wish to go into an academic career, it would be best to pursue a fellowship, which allows you an intense period of time to aggregate that experience with someone who has a good command of that subject area. In the United States, you also have the opportunity to do a fellowship prior to your chief year. And that is not commonly taken upon, but it is an opportunity. So let's say on your 5th year of residency, prior to your 6th, you can take a year away and go on and pursue a fellowship and then come back and do your last year as a chief resident. Very seldom people take this, but it is nonetheless an option. And it is also an option that is available for any other medical specialties, neurosurgery, radiology, what have you. So people sometimes do that. But at the end of the day, you have to think about, okay, what is it that I want to do? And what are the opportunities that exist for me? And if it is cosmetic surgery, that doesn't necessarily mean that you have to go into an academic practice, because cosmetic surgery, you can do that pretty easily within the private practice setting. And in fact, either if you go into an academic or a private practice setting, it would be best for you to position yourself to do a fellowship, because the patients who wish to come to see you, they want to know that you have done some sort of period of intense training within that area. Obviously, cosmetic surgery, I think world over, people pay cash for that process, and they wish to have the best outcomes as possible. So for the only one that goes towards the academic, non-academic track would be cosmetic aesthetic surgery. Now, what are the options? I'm highlighting two potentials here. Again, these are the ones that I can speak a little bit more intelligently about, and that is the opportunities available for the IOMS, and then also the American Academy of Craniomaxillofacial Surgery, ACMFS. We do hold a match, which occurs every year. The results, I'll go over that in a second. But let's first look at the opportunities available for IOMS. Typically, we think about 2 fellowships within the IOMS, and that each one is sponsored by the organization overall, but as you can see here, 2 companies help fund the fellows. So with head and neck oncology, IOMS offers 2. One is the fellow spends a year at the Nines People Hospital in Shanghai, China, and that is supported by Osteoscience Foundation. And the second is supported by KLS Martin, and that individual goes also to China, but in this regard, they go to Peking Hospital in China. So those are the two opportunities for head and neck and microvascular surgery. So this is open to everyone world over. You send your application to IOMS. You can go to the IOMS website and you can see the details in terms of what you have to submit, the CV, the recommendations, and so on, and what you wish to pursue, or what will you use that training for. And then the committee looks over it and then selects the 2 fellows. The same is true for the cleft lip and palate. And obviously, Krishnamurti is here. He can speak with regards to that. But again, this is sponsored once again by Kailash Martin. And again, this individual spends a year in Hyderabad and learns the skill set that they can hopefully take back and use this in their home institution in their country. Again, the idea is you learn, you take it back to your country, and then you begin to teach others so that the specialty grows and moves forward. But the opportunities from IOMS are not limited simply to those 2 fellowships. If you go to the IOMS webpage and you look at the IOMS Foundation programs, you will see on the bottom link here that there are research fellowships that you can use as a stepping stone for, to develop an academic career, or so that people can get to know you at that institution, and then you can use that to change to a clinical fellowship. You can do visiting scholars program where you can go and visit different programs throughout the world so that you can see how that program is run, what are the offers that they have, and then perhaps have the opportunity to pursue a fellowship within that country or within that same institution. So there are many opportunities that are offered by IOMS, and I would strongly encourage the residents on this program to have a look at that and see which ones will be more amenable to you, that fits or dovetails best with your career plan and what you wish to do in the future from a personal standpoint. I was also asked to speak a little bit about the British training, and I'm only going to have 2 slides with that, and I just put those 2. From my understanding with regards to the British opportunities, the British, they have the UK training, they have the Interface Fellowship. And that focuses on head and neck oncology, but they also have an interface fellowship for cleft lip and palate. And again, you have to go, this is the website, you go to the Joint Committee on Surgical Training, and you look at the parameters that are delineated there and see if you qualify for, to apply for that fellowship. And if so, what are the things that you need in terms of your submitting your application and how to secure a spot with the interview process and the like. But I think if you wish to have a better sort of more detail, I would encourage you to see if you can have Dr. Satish Parmar, who is one of the surgeons in the UK in Birmingham, and he can speak more intelligently about the opportunities available in the UK and in the region. He was the past president of the British Association of Oral Maxillofacial Surgeons, and he has a very good command of all the intricacies of the fellowships that are available there. Now, I can speak a lot more intelligently about the programs here within the US for maxillofacial surgeons. About 3 years ago, all the fellowship opportunities were aggregated within the American Academy of Craniomaxillofacial Surgeons. And ASMFS is an academy that is about 10 years old. I currently serve as the president of ASMFS. And it is purely an academic association or academy, and it seeks to provide more opportunities for surgeons and residents and fellows that wish to pursue academic careers and do major surgeries in hospital base. So ASMFS every year has the match, and the way that the match program, for those of you who may not be familiar with the process, is that you look at the available programs, available fellowships throughout the country. So in this case, let's say if you look at the Head and Neck Fellowship, these are the list. You go on that web page, you can click on each one of these programs. You will see the detailed information about them. What do they have? What do they offer? What their fellowship encompasses? Who are the contact people? And you can then submit your application to each one. You are then granted an interview. And then after that, all of the programs send their rank order. Let's say I interviewed 10 candidates and I wish to rank 5. I'll say, for example, Dr. A, Dr. B, Dr. C would be my number 1, 2, and 3 choice. And all the candidates themselves rank the programs. So let's say University of Maryland is my first choice, Miami second choice, and Michigan third. All of those are sent to the academy, and then on July 1st of every year, there's a match. Everyone gets the result at the same time at the same date, and it will say Dr. A matched to University of Miami, and that is a commitment that you have to keep from both sides. So that's how it works. Now, if you look in terms of what opportunities there exist, you have several. So there are head and neck oncology fellowships, there are cleft craniofacial surgery fellowships, there are trauma, craniomaxillofacial trauma, as well as temporomandibular joint fellowship and aesthetic fellowship. So you can go through this site and you'll see a whole host of opportunities available, and also some of which will be available for overseas candidates. Some may not have availability for overseas candidates. So you have to go to that site and you'll find the details. Now, as a program director, we're all looking for different things, but in general, the core is the following. People are looking for a fellow who is committed to that program in terms of, okay, I'm committed to doing a head and neck oncology and then pursuing that as my career. And I'm also looking to change the status quo. For example, I'm going to train, I'm going to go back home, and then I'm going to change the program back home. I'm going to change the fact that in my country, maxillofacial doesn't do X. Now I'm trained in X. I can go and begin to do that and then train other people to do that. And that's how the specialty evolves. And that, those are some of the things that the fellowship directors look. Now, in terms of showing commitment, we also I personally look for people who have demonstrated a history of doing that in terms of they've published, they've written papers, they are collaborated on book chapters with their mentors. And that to me shows a dedication that is not just overnight, but they've had a track record showing that they're having interest in pursuing that particular career. So those things are important. From a personal context, I'll use my example as to how I sort of matriculated through this process. So I began after graduating from high school, I enrolled at Boston University, where I spent 4 years there and obtained a bachelor's in biology. From there, I went on to the Goldman School of Dental Medicine, again at Boston University. I was very fortunate to have Dean Frankel as one of my mentors, and he was instrumental in sort of paying attention to me and believing in me and sort of giving me that energy to look for the next step. And for me, that was pursuit of oral maxillofacial surgery program, and then eventually towards academics. So from there, I went to University of Alabama College of Medicine, where I spent 6 years in training as well as in medicine, and obtained my medical degree as well. And there, my two principal mentors were Dr. Lewis as well as Dr. Waite. And again, both of them were able to inculcate on me the need for, academics, and if that was the path that I was going to take, what it would take. And they were role models, so it was easy to emulate what they did. From there, I went on to the University of Maryland College of Medicine, where I was able to train with Professor Ord in head and neck and microvascular surgery. I spent an additional 2 years there as a fellow. And lastly, I had the opportunity to go to Amrita Hospital, where I spent 4 months with Dr. Iyer and Dr. Kuriyakosu in Kerala. And sort of that rounded up my training. And you can see overall, it was over 16 years of training. But I think that part helped me to sort of get a better sense as to what it is that I was going to pursue, get the proper training, and then and move forward. But the key to remember, I think, is that you need mentors along the way. You can't do it by yourself. All of these people and many, many more were instrumental in helping me to pursue academic career and to get the proper training, and also to push me forward and demand of me what they believed that I could deliver. So now from there, I went on, I came as a faculty member to the University of Florida College of Medicine here in Jacksonville. And we have, these are some of the faculty. We built a head and neck program. Currently, we have 4 faculty within the head and neck program. And we also have, over the years, we've trained 22 head and neck fellows. This is Marina. She's one of our current fellows, along with Camilo. And you can see these are the data points from the fellows that I have trained over the years here at the College of Medicine in Jacksonville, Florida. So they span from all over the place. Obviously, many from the United States, but from Canada, from Europe, from Latin America, all over the place. And truly, I think that has been the best part of my career, because it allows me to have an intense year with 12 months with just 1 or 2 individuals that I can concentrate with and kind of teach, and they teach me as well, and learn from one another. But they're going to go on to pursue the career in another institution. And in fact, as I was preparing this lecture the other night, I was putting together the PowerPoint, and one of the previous fellows from like 6 years ago sent me a picture, as you can see here from the text. And that was him when he was finishing with his baby, who now is on the floor there, no longer a baby, but a big girl. And that is sort of I think the part that I enjoy the most with regards to mentoring young surgeons and working together and seeing them grow. And he is now himself beginning a fellowship program up in New York. And it's nice to see the sort of full cycle of that. So I hope that I kind of highlighted some points as to how one pursues.
Hello,
Hi.
Dr. Rui?
Yes.
Yeah, we lost we can't hear. I mean, that's what we are getting. We lost your last sentences. I'm so sorry about the technical glitch.
Oh,
The good luck, yeah, the good luck slide, yeah.
Yeah, I was just saying that I hope that this was informative to some of the residents and potential fellows. And I'll be more than happy to answer any questions that you may have.
Sure. Dr. Rui, actually, your presentation was extremely helpful. I'm sure that the residents and the newly passed out residents who are looking for direction, they have found some idea and fairly good idea on which how they want to pursue future, especially if they want to look for opportunities in the IOMS. Um, can I please now request the attendees, in case if they have any questions, would they like to have any questions for Dr. Rui, or should we keep it for the end? Dr. Rui, we have time. Do you have time so that?
Yes, I have time. I have the whole morning, so
yeah?
I can wait. Yeah.
All right. Thank you so much. Then in that case, Kita sir, actually Preetham has to leave for his flight. So can I invite him next?
Sure, no problem.
Yeah. Preetham, Dr. Preetham Shetty.
Yeah, Taranjit.
Yes. Hi, Preetham. Good evening.
Hi.
Yeah. Thank you so much for coming, Dr. Preetham Shetty. We are here today gathered to bring to the information of our attendees the fellowship options which are available in India as well as world. We've just finished an amazing presentation by Dr. Rui Fernandez where he gave us an overview of the same at the world level. Now, I would like to invite you to inform us and our attendees on what does Association of Oral and Maxillofacial Surgeons of India has to offer for our young maxillofacial surgeons. Dr. Preetham Shetty.
Thank you.
Yeah.
Thank you, Taranjit. Good evening, everybody. Association of Maxillofacial Surgeons of India has been conducting fellowship since 2015. We have fellowship in 3 streams. Trauma, which is a 1-year fellowship, orthognathic, which is 18 months, and we have oral oncology fellowship, which is 2 years. How our fellowship is conducted is we have 2 exams. One is an entrance exam. The first round is with MCQs. From the MCQs, we usually select 3 times the number of the offering we have. For example, in trauma this year, we have 8 centers offering trauma fellowship. So we would pick 24 students who will go in for an interview, which is an aptitude test interview. From the aptitude test interview, the final 8 candidates will be selected. So once they finish the training, they also have an kind of an exit interview where we take their feedback and also review from the directors. This is how AMSI fellowship is run. So far, AMSI had 87 candidates passed out through AMSI fellowship in different streams. We had 52 trauma fellowship, 21 orthognathic, and we had 14 oral oncology fellows passed out so far. So this year's fellowship, and we conduct this entrance exam in multi-center. This year's fellowship exam is going to be conducted on October 5th. The interview usually happens during our annual conference. That's when the selection happens. And fellowship starts from Jan 1st and it ends depending upon the stream somebody opts for. Is that what you're looking for, Taranjit?
Yes. Yes, Dr. Preetham. That's very helpful. So, Dr. Preetham, since you are going to be leaving soon, we could ask a couple of questions before you leave.
Sure.
Is that fine? Yeah.
Sure. Yes.
So I just want, on behalf of attendees, I just wanted to know that the fellowship program which you have, you said the total number of fellows is 8 that is selected every year in various specialties.
For trauma, it is 8. We have 5 for orthognathic and we have 6 for oral oncology. We might have 2 more centers coming up for oral oncology this year, but at this point of time, we have 6 centers for oral oncology.
And in each center, we are taking 1 fellow each?
Yes, 1 fellow person.
One fellow per center.
Yes, each center.
And okay, so Dr. Preetham, I just wanted to ask you that for clefts, we don't have fellowships as such in India.
Not from AMSI.
Not from there. Okay. So what are the options for clefts if our fellows?
There are multiple options. There are some from the university, like Rajiv Gandhi University. We run a fellowship from our college at Bangalore Institute of Science through Rajiv Gandhi University at Mahavir Jain Hospital. which is also
Okay.
a Smile Train recognized fellowship. There are fellowships at Dr. Goslal's unit, GSR Institute at Hyderabad. Dr. Manikantan has got some fellowship in Chennai. Dr. Jaideep Singh has got at Indore. Gaurav Gupta has got a fellowship in Cleft at Agra. There are multiples of them which are individual fellowships or through Smile Train or through DCKH. Each one of them have their own fellowship programs.
We have Tahura Khiledar who wants to know what are the other centers other than AOMSI which are offering trauma fellowships?
I think AO has got trauma fellowships.
Other than AOMSI, do we have any other centers which have trauma fellowships? AO has.
Yes.
Okay.
AO,
Yeah,
they
AO.
can contact. Yeah, they can contact Dr. Gopal. AO runs some fellowships on trauma.
But they don't have a center, right? AO does not have a center.
No.
They have just their centers are more in all over the world.
Kita sir can give that, can answer it much better because he's also in the AO panel. Because AO runs, they send to different centers.
Yes, they. I think Kanan is also very active in AO, so he will also be able to answer this question.
Yes.
Once we get him here.
Yeah.
Okay. So after the fellowship, do the fellows stay in touch with your center? I mean, if they want to be mentored and they want to stay in touch. And what are the options? I mean, is there, Pritam, I want to know that the age factor. Now, let us say that somebody who wants to do fellowship at a later stage in life, what are the options?
Right now from AMSI, we have for trauma, we have a cutoff age of 4 years post MDS. Whereas if there is somebody opting for an oral oncology, there is no cutoff date at this point of time.
At this point of time, there's no cutoff age.
Yeah.
Is it, we have one question, is it only oral oncology or head and neck oncology?
It's
and
oral oncology. The fellowship, well, it depends on the unit whether they get trained for microscopic surgery because that becomes part of rehabilitation. But the fellowship what is offered is on oral oncology.
Okay. So if somebody wants to train into microvascular, that will be a separate part, right? I think Ganga Hospital has microvascular.
Is Vijay Pillai part of this? Vijay would be the right person to answer. I'm sure part of their training, they get trained for microvascular for rehabilitation of the oral oncology.
Okay. Yeah. Any other questions for Dr. Preetham? How many surgeons are giving exam every year?
From the first round, we started with around 80, then it became 100. Now last year we had around 200 applications.
Okay. Dr. Preetham, I also want to know, there is a variation in the quality of training in amongst the centers. Is AOMSI keeping, check on the quality of surgical training?
Yes, of course. There is an exit interview. Yeah. In the exit interview, we take the feedback of the center. We had 13 centers. Some centers were, since the numbers were not sufficient, we had discussions with the directors and decided not to continue further. So those kind of things.
So there is.
Yes, there is a check and balance. There is the academic activity plus there is a check and balance. Yes.
Okay. Dr. Preetham, I want to ask you one more question. What is happening is that there are situations where if the centers, there are maxillofacial centers which does not have fellows or residents, but since AOMSI does not have a foundation sort of where surgical outreach programs are possible, is there any possibility for AOMSI to look into surgical outreach to be able to send their fellows to those centers where there are no, there's a lot of workload, but we don't have residents and fellows? Do you understand?
You need to apply for the fellowship program. If you are a member of AMSI, you can apply for a fellowship program. When you apply for the fellowship program, if you fulfill all the criteria to start a center, we will consider the center. Every year we take new openings. For example, as I said, there are 2 new openings for oral oncology.
All right. What is the stipend for oral oncology, and how many
25,000.
attempts can we?
25,000 per month.
25,000. Is it separate? The stipend is different for different kinds of fellowships, or is it the same stipend? As in orthopedic trauma and oncology has
it's the same stipend as far as AMSI is concerned. There are some units who pay over and above the AMSI subscribed fellowship stipend that is left to the individual units.
Okay.
But the minimum is 25,000.
Okay, so the minimum stipend is coming from AMSI, and the other is, if the center is well enough, they can give their own additional stipend. Is that what you're saying? And the and the fellows have to manage their own accommodation, right? The AMSI does not take responsibility of the accommodation of the fellows. Fellows have to take care of their own accommodation.
Yes.
It's the only stipend that they handle, right?
Yes.
All right. Is there an option for getting previous year's fellowship question papers or something like that?
No. No, since it's an MCQ, we don't have a question bank.
And what? Okay, so I think, yeah. So tips for cracking an interview for AMSI. I mean, we are always looking for tips.
It has to be the right person to answer that question.
Okay. And for oral oncology fellowships in AMSI, how many months of observership is necessary?
6 months at least.
Okay. Do we have any exclusive observership the way we have it in international?
Yes.
There are,
Do
we have
if
somebody
contacts us, most of our fellowship centers, they give them an observership. Other than that, once a candidate gets selected, we facilitate for them to go and observe the units before they choose the unit.
Okay. And I hope that observership is not, I mean, do the observers also get a certificate or accreditation from AMSI that they have?
No.
Okay, so that is going to be off record, kind of.
Yeah.
No certified observership. All right, fine. And in AMSI, currently, we don't have any fellowship on clinical research, the way we have it in IOMSI, right?
No, we don't have.
Okay. Okay. So if there are any young maxillofacial surgeons interested in clinical research, currently AMSI is not offering options of training.
No,
we don't have them. All right, fine. Anything else? But what if my MBS gets completed around August, when I won't be able to complete my observership for 6 months? What is the solution?
Solution is to join next year.
Okay. And are these fellowship programs globally accepted?
Well, I'm not very sure about this because as such, your basic MBS degree itself is not globally accepted. So, I don't think it adds up to it, because your basic degree has to be first globally accepted.
Is the exam same for all fellowships, or the different kinds of fellowships have different exams?
Yeah, it is a different. It depends upon the subject they select.
Okay.
Questions will depend on the subject they select.
And they can choose more than one also, right? If somebody is applying
they
for
can
trauma,
choose. They can write all three. They can write all three. All three exams are on the same day. They can write all three. Yes.
All right. Okay. Anything else? Because Dr. Preetham is leaving, so please, if you have any questions, this is one opportunity you can ask him. Otherwise, we will have to let him go. With a lot of effort and difficulty, he has come here and spared his precious time for us. Please take this opportunity and ask him any question that you might have.
Taranjit, I can try and log in again once I read that book.
Okay.
If there is something.
How many? All right. How many attempts for oncology? In case if you're leaving Preetham, just answer one question. How many attempts?
They can take multiple.
Is there any limited attempts? All right.
They can take multiple attempts. We had some people, they didn't get the center of their choice. They left that and they came back and gave the exam and they cracked the center of their choice.
Okay. This is an AOCMF question, Tahura. This will be answered by Dr. Krishnamurti and Dr. Kanan. Is that fine? Please wait till they come. All right. I think Pritam will let you go. Thank you so much
Thank you.
for your
Thank you so
time.
much.
It was really
Thank
pleasure
you.
to have you here. Thank you.
Thank you. Thank you.
Have a safe time. Yeah. Bye bye.
Thank you. Bye.
Yeah. Take care. Bye bye. All right. Oh. Okay. So, Subhajit, we will answer these questions in the coming in the coming hour. All right. Please keep posting your questions and they will be answered, hopefully. Our next speaker is my dearest mentor and friend, Dr. Krishnamurti Bonanthaya. Krishnamurti sir.
Yeah.
Can we have you on the screen? Well, your
I am on the screen, and I, yeah. Okay.
Yeah.
So, good evening, everybody. Taranjit, thank you very much for inviting me to this interesting program. I hope I'm audible. I don't have any presentation, and I think a lot of things have been answered. I think Rui Fernandez laid out not only the details of what's available internationally, but also a philosophical discussion about why fellowships, and with his own example, he showed how you progress that way. So I was asked by Taranjit to talk about the origins and the thought processes behind the AOMSI fellowships. I think Pritam has stolen my thunder. He's answered most of your questions. However, whatever thoughts that I have in my mind, I'll add on to that. But before I go to the AOMSI fellowships, as Rui mentioned, I'm also part of the IOMS fellowship as one of the trainers for the Cleft Lip and Palate fellowship. So we've had IOMS fellows coming to us and Hyderabad 6 months period each with Dr. Ghosla Reddy for the last 5 or 6 years now. We have trained candidates from Iraq, from Sudan, from Israel, and we were waiting for from the Dominican Republic, and we were still waiting for someone to come from Mongolia. Right now, IOMS has frozen this program because of the COVID issues. So we are still awaiting a candidate to come in from Mongolia. And I'm not sure when the next selections will happen, but obviously COVID willing, it will happen. So this is a 12-month program, out of which 6 months are spent with our unit, in our unit, and 6 months with Dr. Ghosla Reddy. Like Preetham mentioned, he and I also, along with our other colleagues, run a program for the Rajiv Gandhi University, which is a one-year fellowship, and we take 2 candidates every year. But I'll go back to the AOMSI fellowship. You know, the way things evolve in different parts of the world are different. Rui clearly mentioned what is the rationale and how they administer their programs. Basically, we did start this AOMSI fellowship 6 years ago. The whole idea at that point of time was not so much to develop subspecialty fellowships, but to provide adequate hands-on experience in what we would call the basic core bread and butter maxillofacial surgery. Because over the years, as training centers mushroomed in this country, we found that there was a significant level of indifference or difference, whatever you want to call it, unpredictability about what you were exposed to and how much of hands-on skills you acquired during your training program, what we call the MDS. Therefore, we decided that when we initially started on with this fellowship program, there would be the bread and butter core areas of maxillofacial surgery, which was trauma and orthognathic surgery. Though in some parts of the world, many parts of the world, maybe by the time you've finished your residency program or your postgraduate training, you should be more or less ready to operate on your own in these subspecialties. But we realized that in many situations, people were not getting enough exposure, not enough hands-on, and therefore, when we did start these programs, a few years ago, we were concentrating on these two areas. And we also went out of the so-called teaching institutes or dental colleges, because in our days, I'm now talking about 25 years ago or 30 years ago, most of the post MDS training came in the dental colleges. So people joined in as junior staff. They not only taught, but they also learned. So that was the best method of gaining surgical skills as well as teaching experience in the past. But today we have reached a stage where there is a kind of stagnation as far as recruitments in dental colleges go, as well as a lot of work has moved out of the realms of the dental colleges into bigger hospitals, which are NGO run or private sector hospitals. So when we decided to run this AOMSI fellowship, we took a conscious decision, the way the criteria were set for selection of centers, to try and go out of the dental schools where there are already many postgraduate students and junior staff. Though we do have one or two centers which are located in a dental college, mostly these are in single surgeon or two surgeon areas, which are private hospitals, where the exposure for hands-on training is tremendous. I can give you just a couple of examples. There is Kannan, who is here. Kannan Balraman runs our flagship trauma program at the Ganga Hospital. Though it's a teaching hospital, they don't have maxillofacial trainees. Kannan and Vimla are the two consultants there, and if you go there, you will be exposed, and you will be probably burdened with enough work to do. There are various places like that. Our flagship orthodontic centers are in Trichur and in Mangalore. Once again, Trichur, where Dr. Philip Matthew runs this program, he's a single surgeon working with an orthodontist, and the surgical trainee or the fellow is exposed to such a voluminous amount of work that they come out as confident surgeons. That was the key. And then after a few years down the road, people started saying that why just have trauma and orthodontic? Why not add on the super specialties or the subspecialties where you may not get enough exposure, like Rui was talking about, the head and neck oncology, the cleft craniofacial surgery, etc. So after the second or third year, we started off with the head and neck oncology thing. It's an extremely valuable part of the AOMSI fellowship today. We must remember that it's not just maxillofacial surgeons who are training our candidates. We have a very well-known doctor who has a Padma Shri, who works in a small hospital in Assam called Culture, who trains our candidates. There is the ENT, Dr. Trivedi, who trains our candidates at Mehsana in Ahmedabad. So we have the surgical oncology fellowships, which are run by people who are not maxillofacial surgeons. They are willingly giving their time and effort training our candidates, and this is turning out to be a very, very successful as well as a very important addition to the kind of training programs that AOMSI has started. Quickly talking about non-AOMSI fellowships, somebody wanted to know. I think we have a number of these that Preetham mentioned already in our website. The most common ones will be, of course, cleft fellowships that are available around the country. Sure enough, in times to come, we have some TM fellowships that will start off, and we also have a request that comes out from, like Taranjit was mentioning earlier, to have a fellowship in general max fac surgery as well. We have a number of very skilled and experienced max fac surgeons around the country who don't do exclusive subspecialty work, but do bits and pieces of everything. And there is a proposal that we should have a general max fac fellowship as well, where you go and rotate with these successful maxillofacial surgeons learning bits and pieces of everything. So there are a lot of things in the pipeline. What I would think is that it's just the interest of the young doctors, of the young trainees, how far they're willing to go. in the last 1 minute, I would like to also talk about, somebody asked about how you crack the interview. It's a very important thing. And you also heard what Rui was saying. I looked at the aptitude. What is very important is though in AOMSI fellowships, we have an exam that looks at your academic skills, because necessarily we have to do that because we have hundreds of candidates that are coming in for a few positions. Even now, there are people who believe that these fellowships are fixed by the old hags like me, but believe me, it does not happen. We just go by whatever criteria we have set. I hear Dr. Vivek Vardhan Reddy, whose Stephanie I am here today, in fact, has received phone calls from people asking, is it already fixed, or can we get it, can I get it done without this exam kind of thing. So necessarily looking at our cultural scenario and the numbers that we have had, we've had to do this elimination exam before we did the interviews. But there is one thing that you need to understand as a fellowship director. What I am looking for is not how you can crack the MCQ. Obviously, you've got to do that because otherwise bias comes in. Our shortlisting is going to happen from that. But beyond that, if I have to get interested in a candidate, he or she also needs to show interest, and that can be done in a number of ways. One of the important things is to visit the center. You don't have to be an observer for many months. You can be there for a few weeks. What that does is it allows both the trainer and the trainee to assess each other.
Did we lose Dr. Krishnamurti?
Yes.
Yeah, his network was little. Never mind. I think he'll join again. There were some very important points that he was mentioning.
Hello, can you hear me now?
Yes.
Yes.
Yeah, sorry, I
no
lost you all.
Absolutely no problem.
So what I was trying to say is that it is extremely important, not only for the trainer who's going to select the candidate, but also for the trainee to know what to expect, because, for example, if somebody comes to my chaotic place as an observer,
We lost his voice again.
I'm sorry, I think there is a conspiracy by the server to allow me not to say this, but very quickly I'll tell you, the chaotic atmosphere in my place might help make up the mind of an observer. Oh, not here, not for me. And it also helps us to gauge what kind of interest, what kind of aptitude the candidate has. And once you have cracked your exams, the single most important thing that will help you get in is whether you have been able to impress your trainer. That is the perspective, particularly when we have too many candidates. It so happened we just selected. Can you hear me, Taranjit?
Yes,
Yeah.
sir.
It so happened that
it's just that we can't hear, we can't see you, but that's okay.
That's
what you're
okay.
saying is extremely important.
Yeah.
Yeah.
So we had about 20 candidates this time for 2 positions, and all of them were good. Necessarily, we had to reject 18 of them. So at the end of the day, it's the subjective evaluation, looking at the CV, like Rui said, publications, right? Showing interest in different forms is what makes us pick those 2 out of the 20. Leaving the others disappointed, thinking that maybe we fixed it. Believe you me, we don't do that. I'm ready for the questions whenever. Thank you very much, Taranjit, once again for this opportunity.
Thank you so much, Dr. Krishnamurti. You, as usual, you spoke from your heart. You spoke the honest discussion that we have with you always gives us the right answer that we're looking for. We'll now have Dr. Kannan Balraman, and after that, the session will be open for question and answers with all the 3 mentors as panelists. Dr. Kannan? I'm handling 8 panelists today, divided into 2 sessions, mentor sessions and mentees. So there are technical glitches. Please forgive myself and the time here. Thank you so much for bearing with me and having patience. Dr. Kanan, you're there?
Yeah, yes, sir. Yes, Taranjit.
Yes, Dr. Kanan, thank you so much. You are in the town. Amazing. I love this. Yeah, okay.
No, I
So,
misjudged. I thought I was waiting. Then I realized my time isn't coming. So I'll reach there quickly, but then I got stuck again.
Okay.
Dr. Krishnamurthy finished earlier, or Preetham jumps again.
Preetham jumped again. You know, we know Preetham. So, yeah. So,
Now, just to put my comments,
yeah.
What Dr. Krishnamurthy and probably maybe I don't know if Dr. Krishnamurthy and Dr. Vivek Vardhan Reddy have put together is something unprecedented. What
Yes.
Dr. Rui Fernandez was saying is the onus of training the candidate is in the hands of the association, with the not association, the hospital, with a fellowship in the West, in America or UK or wherever he described. Whereas in India, it is still with the universities and the teaching hospitals. So in this context, to put together a fellowship program only from the view of giving hands-on or mentoring people is unique. So our fellowship programs or the background of our fellowship programs are totally different from what you're hearing about the Western ones. Instead of
Yes.
MTS, the Western ones is a direct fellowship program combined, and it's a 6-year program, 5-year program.
Yes.
Here our MDS is 3 years, that gives you the license to practice, whereas what else you get is basically mentorship and hands-on.
Yes. And in that way, individual centers who are doing good work are also getting an opportunity to train young maxillofacial surgeons like yourself, right? Since you don't have an institute, yeah. Can you please share with us your experience of running a trauma fellowship center? I suppose it's since 4 years that you are running this?
No, it's the 6th year running now.
It's the 6th year, all right.
So one of the criteria which Dr. Krishnamurthy didn't allude to, but which was there, one of the things which was there in the application which you fill up is how many staff are there, their experience.
Okay.
How many trainees. So you get points. You need experienced staff. You need maybe 1 or 2, but if you don't have many middle grade staff or junior staff, then you're given more points because their thinking was the fellow will get some work there.
All right. Yeah.
So otherwise, yeah, you have a lot of tired people at different levels. We don't know what job or what hands-on the fellow is going to get.
And can you take us through how the fellows are, how the fellowship training runs in your institute, in your in your hospital?
As you say, specifically in our institute, it is we are as he said, we don't have a formal fellow in maxillofacial. We are a specialty hospital which is specifically for orthopedic, plastic surgery, and anesthesiology. We have maxillofacial and neurosurgery and diabetology and geriatric medicine as part of the team. The rest we don't have. So it is a specialty hospital. The rest are referred to or we get visiting specialists. So the 3 core areas have DNB trainees and we don't have any trainee. And in this background, the fellowship opportunity came up from AOMSI and then we put our application in and we were lucky and happy to be part of it. And then we get a fellow. The fellow, once he writes the exam, interview is over and he starts. Once he starts with us, it is bedding time, meaning we get fellows from all over the country, and knowing the language, getting used to the place and getting used to the work culture is also demanding for some. So it takes about a month or 2 to settle down. I don't know if some of our previous fellows are here. I'm not too sure. So once they bed in and then they get cracking on. So the thing what helps them is there are a lot of fellows in other specialties in the same realm, like orthopedics or plastic or anesthesia, who are there kind of new or just 6 months ahead or 2 years ahead. So with whom they can interact and take it.
All right.
So for us, yeah, sorry,
okay.
go on.
No, please continue. And then I
No,
would
for us-
invite
Yeah.
for you.
No, yeah, for us the challenge is let me 1 second. I'm just stuck in traffic. For us, the challenge is getting a motivated fellow, because the work environment might be a bit more challenging than what they are used to in college. So in college, you have a 9 to 5 duty with some night duties or something away, and then you go. The entire scene changes. The idea of them being with us, what it does is gets them prepared for private practice as well.
All right.
So the fellow gets mentoring, gets skills, and gets to interact with other specialties as well.
Can I please request Dr. Rui Fernandez and Dr. Krishnamurti to be open for the question answer session with the attendees. And if we have any questions for Dr. Rui Fernandez and Dr. Krishnamurti, along with Dr. Kannan, the session is now open for question answers with our mentors.
And hello.
Hello.
Yeah. Hello,
We
ma'am.
have Dr.
Many questions
Krishnamurti.
which is related with the confusion of oral oncology observership. For AOMSI oral oncology fellowships, how many months of observership is required?
Krishnamurti sir. Do we have any questions for Dr. Rui Fernandez from our fellows? Dr. Fernandez, in that case, I would like to know the International Association of Oral and Maxillofacial Surgery, IAOMS fellowship. The same question goes, is it, there is an age bar for this fellowship as well?
So for the international, there is really not a cutout, but the preference tends to be for the younger surgeons within 5 to 10 years at most. And I think part of that is just looking in terms of the return on that investment, how long you're going to be in practice, your ability to teach, and so on. From the others, you know, within the US, there's really not a time. One of the candidates that matched this year, she's, I think, 65. So kind of give you the perspective.
That's amazing.
So, yeah.
Okay.
So
there's hope here. Okay.
Yeah, so it's really depending on the individual. One of the things that I would mention though is, and I think it's been consistent with Dr. Kannan and Krishnamurti and others, is that so in neither the IOMS nor the US fellowships, we don't have exams as an entry point. It's just you apply. I think the key point though is to make sure that there is that you and the potential fellowship director, that you guys have a good match in terms of personality, in terms of sort of overall ambition and the like. And I think that's the benefit of going and visiting different centers. So you can see, well, this individual, my personality doves well with him or her, as opposed to going in and finding out that this person is always angry and you're not an angry person and you don't get well, because it is a lifetime you become part of each other's families, and it's a lifetime mentorship. So having that individual, it's very, very important, I think.
Yeah. I totally agree with you, because the role of a mentor is much beyond the subject, beyond your skill. So, you know, your mentor will have technically a role to play in the complete thought process of yours, and it might even change your personality. So he or she is your vision of yours in the future. So would you like to see yourself as this person in future? I think that was one criteria for me to choose my mentor. When I met Dr. Sanjeev Nair and Dr. Krishnamurti, I could totally think that, yes, this is how I would want to be, and that is how you pursue to be with them, you continue to associate with them, you not just related to the subject, but other things as well in life. You share your worries and your happiness. And that's how fellowship, I think, is a continuous process rather than a pinpoint phase in your life. That's how I have, that's how I've seen that. There's a question for you, Dr. Rui. So after MDS in India and 6 months of observership, is it necessary, and how many publications are needed minimum if in oncology, or is it okay if we have do you think that the publications are needed in oncology, or is it in the general maxillofacial if they have publications? Even then, with observership criteria, they fulfill for oncology fellowship. I think that's a very interesting question.
Yeah. So to begin with, let's unpack the observership. The observership is, you simply approach, or in terms of IOMS, you go to the website and you see what are the options available to you. You don't have to demonstrate any publications or anything like that for an observership, because typically you go to a center for a week or 2 weeks, maybe a maximum of a month, and you get to see what that center does. So there's no prerequisite. And neither in the US, most, like, for example, in my center, if someone wants to come, they just simply send they send me an email, and the coordinator looks and it gets the paperwork set in terms of the what we call HIPAA, some of the minor things that need to be, but there's no prerequisite.
Not even a recommendation letter from somebody in India?
Not necessarily. Yeah.
No,
so
you don't need a recommendation.
Not for an observership. We make it available to anyone who wishes to come. However, obviously they have to support themselves during that time, but there's no prerequisite. With regards to publication, obviously, if you have a publication within the area that you're applying for, it demonstrates that you have interest within that area. So if I'm applying for cleft craniofacial, I show that I've written about it, that I've have a commitment to that subspecialty area. One of the things that I would differ with, so it was made mention before that from the Indian Association, you can apply to all the fellowships.
Okay.
So for me, that would be a big red flag for me, and I would not consider that candidate.
Okay, because you will think that this person is confused and they don't know what exactly.
You're not committed.
I get that.
Just
not
show no commitment. So to me, that would be a candidate that I would not even contemplate interviewing. So it's because you can't be interested or wishing to pursue head and neck and at the same time cosmetics and at the same time this and that and the other. It shows, to me, it shows a bit of a lack of commitment. So that would be a problem. But I think overall, not to get too caught up in the numbers, just show that, you've published, you have some interest, you're carrying out some research, you're inquisitive, you're looking at your own data, you're questioning your outcomes, those types of things. I think that's all it is just to show an inquisitive mind and a commitment to learning, lifetime learning, and those types of things. So that's what I look for. And I think most of the directors that I'm familiar with, that I interact with, also look for.
I think what you're looking for is an authentic inquisitiveness, because I'm sure you can pick an authenticity from an inauthentic one, right? And
sure.
Most of the time we are trying to impress our mentors because we want them to take us in, and that shows somewhere. The mentor can see that there's lack of authenticity. So I think stay as authentic as possible to your commitment. That's what I understand from you. There are some questions for you, sir. So after MDS in India, okay, this question is taken up. Is there a dual degree requirement for IOMS fellowship?
No,
Not even in onco.
you could be single degree from a dental or single degree from a medical, it doesn't matter.
Because I think the onco fellowships are in China. Yeah,
Correct.
China does not. So it is the requirement of the home country where the fellows are going, and that is how it is not required. Would you say something like that?
The IOMS selects, because we are a global organization, there is no, and with the understanding that there's degree variations throughout. So we represent all maxillofacial surgeons. So there is no prerequisite in terms of degree. As long as you're a maxillofacial surgeon, that is the key to entry. So
we have answered a question that your degree would be valid for fellowship in IOMS, right?
Well, IOMS they have in the past have selected several candidates in head and neck from India, from Pakistan, from Bangladesh, the region. So yeah.
Yeah, so I think that was the concern for most of our young postgraduates here. And countries where we go for fellowship after completing MDS in India. So the fellowships which you have mentioned, Dr. Fernandez, they are mainly, I think the cleft fellowships are mainly in India. And two fellowships which you mentioned.
The one that Krishnamurti can correct me, but the one from IOMS that's in India, and then they used to have one in South Africa in Pretoria with Kirk Putau, where the fellow would spend 6 months and 6 months, and then there was also another opportunity at, in Orlando, Florida, with Ramon Ruiz. But because of some of the credentialing issues, that was mostly an observership. So from that
yeah, so that one is no longer existing as IOMS fellowship. It used to be, but for some reason it's no longer offered. Yeah, with I think Professor Buto has retired in South Africa, and I think after that it got stopped. Yeah,
correct.
Any more questions? Dr. Krishnamurti and Dr. Rui, there was a question where, one of the attendees had asked us before the session that once they take up a fellowship in a particular specialization, and in future, if they don't get that kind of work, don't they, what about the general maxillofacial surgery? Do they just get stuck with the fellowship which they have done? And, so they lose out on general maxillofacial surgical practice because they get labeled or stereotyped like that. So how do they negotiate with this situation?
Krishna, do you want to answer that?
Yeah, so we have not had that problem so far in India because there's so much work to do. I've never found somebody finding it difficult to find work. It's generally, but if someone is not successful, he could become a little frustrated. But as of now, I don't see that kind of a problem happening. There was a time when we had issues getting to start cleft centers in India because it was seen as a plastic surgeon's domain, but it's no longer the case, even though we are only about 20% to the 80% plastic surgeons doing cleft work in this country. Every year the graph is going up. So I can speak for cleft and craniofacial. As of now, this issue of not being able to do the work is a concern, but it is something that can very easily be negotiated. But yes, it could be frustrating if for some reason you're prevented from doing that.
Yeah, so from in the US and in other places, the ability to practice is one that is sort of really coveted. So, and so there's also the issue about the restriction of trade. So most of the time, if you demonstrate that you've had proper training, you will be able to do those, the procedures that you've been trained in. So that has not been an issue. I understood the question more like, having done a fellowship, are you now not going to be able to do general maxillofacial? Yes. And that, no, it's just an additional training. If you choose to do general maxillofacial, you're welcome to do that. I think it's just, again, one of those things where selection, why did you do it to begin with if the interest is to do general, and that sort of kind of sorting out that from a personal perspective. You may find that you've done the fellowship and you've gone and you've done it for a few years and now you wish to transition to a general. That is fine. I don't feel that someone is going to say, well, you're too overqualified as a surgeon to do this or that. You can do whatever you like. I don't see that as a problem.
I agree with what Rui is saying. So if you wish to continue doing whatever skills you have acquired before you did the fellowship, I don't think that's a problem.
And at the same time, when, as Dr. Rui says, that if you have a commitment towards a particular kind of surgical skill, it is also an inclination from within. If you have that inclination, you do a fellowship, I'm sure you'll find a place where you can practice that. Then you will not wander around. But in case if there was this lack of clarity right in the beginning, then probably the wandering will be more, and eventually you might not be able to use your fellowship as efficiently as you would have, and that is the reason why to have a commitment towards a particular type of specialty right in the beginning is a good idea. So it's a good idea to find out what your calling is right in the beginning before you enter into it, right? Is that what I can conclude from this?
I agree.
It's a good idea, yeah?
Yeah. I think it's a must.
So, yeah, it's a must, yeah. So we have a couple of questions and then I think I'll have to let you go, and then we will take all the questions on email and we'll send it to the mentors so that you can get your answers, because the session is really going long. Minimum duration of fellowship internationally, will this observership from that country will be counted in getting into fellowship later? So once you do an observership, and then will that observership would be counted for doing fellowship later, either in IOMS or AOMS side, both?
No.
Please answer this.
No.
Okay, so these are two separate things, don't mix them. Yeah?
Right. So the observership tends to be just that, observing, whereas fellowship, you're actually operating, you're doing the clinical work. So one cannot count for the other.
Yes.
And done somewhere else is not also, like for AOMS side, it will not be counted, right? If they have done observership somewhere else.
Yeah. So there is another question there, I think, from Dr. Bhaskar Roy, who's asking about, he's asking whether this 6 months observership is mandatory. Is that the word he's using?
Yes, he's using the word mandatory.
Yeah. So Dr. Bhaskar, it's not mandatory, but it is desirable. So what that means is, if we have two candidates, one of whom who are equal in all other aspects, but one has an observership in an onco unit, he'll be preferred over the other person. The reason is very simple. The reason is that you won't feel like fish out of water on the first day of your fellowship. We already know that you know what it involves. If you are called into the ICU in the middle of the night after having done a flap surgery or whatever else. So basically, it is a reassurance for the trainer that we are not taking a complete greenhorn, which can be done, but trainers prefer someone who has some prior exposure. So it's not mandatory, but it's desirable.
Wonderful. Dr. Rui, we have one question for you. Doing a fellowship in US will help in pursuing OMFS practice in US?
So doing
Somebody
a
wants
fellowship,
to settle in US, yeah.
Yeah. So if you do a fellowship in US, it allows you to set the boards. So you will then be able to sit the American Board of Oral Maxillofacial Surgery. And then theoretically, if you do that, then you're successful. You can get, it's easier for you to get an appointment as a faculty and work, as a faculty. If you wish to go to private practice, then you still have to get an independent license. So for academic practice, you can get a restricted license to practice within that institution. So as a faculty, you can do that coming from India or wherever. But if you wish to go transition from academic practice to private, then you have to be able to have your own license. So to the question, yes, it allows you have the opportunity to then sit the board and then potentially stay in the US.
Wonderful. One last question, and then I'll let you amazing people go. And that is, Dr. Krishnamurthy, what are the books that they should be referring to for fellowship?
For fellowship? Which fellowship?
Yeah, AOMSI fellowship. If they want to appear for an exam, are there any particular books?
No, read any standard textbook. Like Pritam was saying, if you're applying for the trauma fellowship, all questions will be on trauma and so on. Yeah, standard textbooks are good enough. Right now, I would like to plug the AOMSI textbook, but it's not necessary you have to read that.
All right, fine. Thank you so much. Any more questions? Otherwise, our mentors will be signing off now. Dr. Kannan?
Thank you.
Thank you so much. Thank you so much, Dr. Rui.
Thank
it was
you.
amazing.
Yeah.
Thank you so much
Thank
for
you very
giving your
much.
time. Yeah.
Yeah, appreciate it. Bye-bye.
Bye-bye. Stay safe. Dr. Kannan,
Yeah. Hi.
have you reached your destination?
No, I've stopped
Still
on
in
the
the
roadside. Yeah.
Okay.
I've
So,
stopped on the road.
Dr. Kannan, we had a couple of questions on AOCMF, which our mentees wanted to know, and then we will let you as well go, because the session has really gone beyond the time frame. So please answer some of the questions on AOCMF. What is the difference between AOMSI fellowship and AOCMF fellowship? How are they different?
The something about the AOCMF fellowship, I think Dr. Varun had put a link in the chat box. So anyone wants to know or read about them can click on it. The main difference is AOMSI fellowship runs for a year or a year and a half. It's within the country, and it's for freshers passing out people, or within a time frame, I think 5 or 8 years, whatever becomes. Whereas AOCMF is a short fellowship for about a couple of months, 6 to 8 weeks actually. So based on your area of interest with which you're applying, they would assign you a center. You won't know where you're actually going. You can maybe make a preference, but it depends on if that center is taking a fellowship. So for example, you might be interested in orthognathic and you send in, and then they will see that year which are all the centers offering or taking in people, and then they'll send you there. But it's only for a period of 6 to 8 weeks. And then you're off. So it's a paid fellowship. You'll be funded. They give you, I think, 4,000 francs, Swiss francs. So it'll cover your travel costs, stay there. But there might not be any licensing part of it. So meaning you can't operate there, but you'll just be observing. Just scrubbing up even to assist, it is on the center director's discretion, but you can't do much.
All right.
It is for a slightly experienced person, so he can observe and understand the concepts and come back and apply them in his practice.
All right. And Dr. Kannan, how confident are your fellows by the time they leave? What are the works that they can do at the end of the fellowship? How confident do they feel?
That is a tricky question because it varies, isn't it? So, and it depends. Like last year, if it's COVID, Pritika, who was with us, she was cursing, not cursing, she was upset with the entire universe for conspiring against her. She said, lo and behold, I come for a fellowship and then COVID strikes and it wipes it out. So we don't know, but what we aim is we sit down in between and we try and discuss with them what their goals are. It might not be an organized paper format. So they might have their goals, but as a director, we will promise them what we can do and take them through. Then we come at a common ground, kind of like an appraisal, and break it down and then try and do it case by case and then tell them what they can do to improve it. So
All
At
right.
least with trauma, we look at diagnosing, basic decision making, and some fixations like the mandible, not straightforward, at least a little bit more mid-face. We try and get them
Yes.
everything in trauma at least.
All right.
Full
Dr.
CMF,
Karan-
at least they'll have had 1 or 2 cases which they would have
And
done
then
independently.
CMF is now conducting these MFT courses, right? So whoever does not clear the fellowship, trauma fellowship, and has interest in trauma can participate and get themselves trained, right? Would you suggest
Yes,
that, Dr.
yes.
Kanan? Yeah.
Yeah, the AOS CMF again has basic plating courses which you can do,
Yes.
and it's interesting now.
They're very
it's,
helpful, yes.
Well, yeah. So there are a lot more case discussions. So that helps. That is a basic course, and you would have advanced courses there as well. But I think
don't know.
this we discussed to bring it up. I think Dr. Ruiz said, I don't know if people saw the picture with the fellow, the kid growing up for
Yes.
6 years. So it's
Yes.
fellowship, at least we think, or there is a disconnect, let us say. From the director's point of view, it is more of mentorship. The way the questions are coming, we can understand from the candidate's point of view, it is either a hands-on or a job. I finished my
Now I want a
MBS
job.
and I want a job. I can't be alone.
Yeah.
So the problem is most of the questions which came or which you asked the directors, it's probably the background is that we just want a job, and then probably fellowship is not the right thing, because it's a short-term gap for a year and then you might feel frustrated. We are in a field which is kind of what you call surgery, and the more you do it, the more comfortable you become with it, if I may say so. So you can never be comfortable in 3 years or 4 years or 5 years. It is evolving. And that's why the Western fellowships are 5 to 6 years. That is a training program as such.
Even in Bangladesh, as Vaidul was explaining, that fellowships are part of training program. They are not separate. Yeah. So I think that's the difference. In India, after fellowship, we are thinking in terms of jobs, but fellowship makes you a better surgeon. It doesn't guarantee you a job. Yeah. It makes you a surgeon who probably knows better and does lesser complications. But yeah, it doesn't guarantee you a job for sure. And there was one important part that I forgot to mention. Dr. Krishnamurti had shared this with me, that onco fellowships in India are not recognized by Government of India. So whoever is interested in onco, please know this, that if you're applying for a government job, the onco fellowships are not of AOMSI are not recognized by the Government of India or state governments. They still mandatorily ask for MCH in onco surgery. So that is still a journey that AOMSI has to take towards where our onco fellowships become accredited by government. I think that is something DCI or the new organization that comes will have to, create an. So with that, I think, is there anything else? Our AOMSI, the automatic and trauma fellowships are recognized in India. Yes.
No, there's nothing. Can I say add on to that?
Yeah.
No, none of the fellowships the government is recognizing. It is just enhancing training, as you say. But if it comes to a legal issue, your fellowship training gives you a structured way. Your logbook and your mentors and the institute are your backing.
Okay.
So when Government of India set up onco jobs for cancer surgeons, it would have been a secretary who is doing, and it would have been some medical doctor who would have advised them.
Yes. Yeah.
So that's what I said. People, if they are looking at fellowship as a gateway to a job, then that is the wrong notion.
Yes.
If you think that I've finished MDS, I would like to enhance my skills in this field, then yes. So because onco involves a bit more comprehensive, they want observership. For trauma, we are okay because we feel that somebody has had a feel of trauma already in college. But we will still get people who will say, I want a bit more experience in trauma, though they have been in a good college where they are exposed to most of it. Or some might say, I've had enough of trauma. I know I'm comfortable with trauma. I would like to do orthognostic. But
I
most of the
feel
centers,
most of the colleges have, Kanan, the lower, the mandible, most of us are able to handle, you know. It's the midface and the ethmoid, nasoethmoidal fractures, which are a challenge. And not many centers are still doing that, if I'm not mistaken, you know. I don't see many maxillofacial surgeons talking about doing that part. So I think the main interest a fellow in trauma should have is in how to fix the whole of craniofacial skeleton, right? Yeah.
that's true. That's true. And that, so far we have been good and lucky, or we are in a position where we will be able to give that to a fellow. Whether he gets experience in a single case or after 10 cases, that's an individual perspective.
And I think we should make it, we should really make them understand that surgery is a very sustained profession. You know, you learn every day from your own experience. You learn from observing, watching your mentors, other people, your own mistakes. So don't lose patience. It requires a lot of patience to be a good surgeon. And 1 year of fellowship or 6 months of observership is just a beginning of the whole thing. In fact, one can do observerships all throughout your career, isn't it? I mean, I like to be an observer periodically in various centers and update my skills, you know, and come back and do it here. So that's how we can do it. We can always craft our career as per our own situation. Dr. Kanan?
No, absolutely. I think that's well put. It is surgery. Sometimes you learn from the trainee, the question the trainee asked or something he has seen, and then he tells, do you think this will work this way? So far, you might have been biased, but that question gets you thinking.
Yes, it does. Dr. Kanan, I think I must start with Mentee session because we are really late. And thank you so much for your presence. In spite of this difficulty, you made it a point to be with us and answer our questions. And, you know, so thank you so much. Wishing you all the best in all your endeavors.
Thank you.
And I hope that you get amazing fellows. Yeah. Bye-bye. Namaste. Yeah. So let's start with our Mentee session now without a break. Our first Mentee is Dr. Sandhya. Sandhya, I always get scared with your surname. Can I just do we have Sandhya?
It's okay. Just call me Sandhya.
Yeah. Hi, Sandhya.
Hello.
I can see that you have a amazing looking CV here. Everybody can see here, and you are mainly what I think we all want to know is your journey. You know, most of us are under the impression that women and onco surgery, and you know, it requires a lot of commitment, and there's a lot of people who think a lot. Tell us about your journey, please.
Yeah, I'll start.
See your video. Is there a problem with your video?
Okay. No, I think. Can you?
Yes, right. Thank you. Yeah.
I'll start with my first of all. Thank you for giving me this opportunity. And I'm not much into teaching hospitals, so for me to reach out, this is a great opportunity. And I'll start with my journey after my post-graduation. I finished my post-graduation in 2011. And during post-graduation, whenever we went to conferences and all, I was very much excited looking at the surgeries. Dr. Saidul Islam was presenting all his videos of the cases, and also Dr. Moni's presentations. This was on one direction, that was in another direction. Both together was like something which I wanted to become, frankly speaking. They were all, they both were like my role models. And but then I definitely had doubts if I would survive oncology or not. So I never really tried to make myself very ambitious at the first point of time, but one step at a time. So immediately after finishing my post-graduation, I was already married by then. So for me, getting out of my city without a definite fellowship program wasn't practical possibility. So I just joined a tertiary cancer center, which is there in Hyderabad. It's a Basavataraka Indo-American Cancer Hospital. In 2011, 12, 13, at that period, the work volume was such that we were operating around 500 oral cancers a year.
Okay.
And I was the only maxillofacial surgeon. I was the only female surgeon over there. I just joined as a registrar, and they had lots of staff crunch issues. And that's how I got a little bit of an opportunity to get in. By then, they didn't have a DNB program also. They were trying to get DNB programs. So probably it was the right timing for me to be therein. And there were very less number of theater, like 5 to 6 theaters, and there were about 25 cases every day. So what was most important in the center was OT time. So as long as you're able to operate, you'll get an opportunity. But you have to be very fast picking it up, and you should never complicate anything. So yeah, as long as you can keep your unit head, in your confidence that you're not going to complicate, they will let you start operating at their comfort levels. So I got enough opportunity. First 6 months and all, I was assisting, but after that, I slowly started getting to raise the flap and slowly started getting to do the neck dissection. Slowly, I eventually, I was the favorite of the plastic surgeon also over there. So started getting to raise a pec major flap. And within 2 years, I had operated everything, frankly speaking. But the whole problem is this was almost like a private hospital. It was not a extremely academic place. So to be able to, stimulate my mind, I needed to go to conferences so that, I know what I was doing, lots of things, but I didn't know whether it was the right way to do it, because I wasn't probably updated also. So that's how I started going to AOMSI and FHNO conferences. Then I came to know about the fellowship which was available at that time. Only Majumdar Shah Cancer Hospital was offering fellowship for MDS Max Fax, and probably only Malabar Cancer Center. But organized fellowship was only Majumdar Shah Cancer Hospital. And by the time I wanted to apply there, I was applying there. But then I already finished 3 years of my registrarship in the Tertiary Cancer Hospital. And I came to know that you're supposed to have, I was interested in research, but I didn't have a mentor. But then I was in an institute where I was doing at least one night duty a week. So what I did was just looked into what is most important to get into the next level. It was the publications. So what I did was next, all my night duties, as long as I wasn't busy, I started segregating data of all the patients. So I made a data of almost 3 to 4 years, all oral cancer treated patients. Then I started doing analysis and then started publishing, looking at what were the most recent publications made. Okay. And it was very difficult initially. I didn't even have probably a very balanced English to write a decent paper. So initial papers of mine where the comment was, we are ready to publish it as a letter to editor.
Oh.
Because data is good. But I wasn't very good at writing paper, and I didn't have a mentor for it. So I kept learning from the reviewers. Frankly speaking, I learned from IJOMS, BJOMS, and reviewers only how to write a paper. They kept correcting me. I kept writing and I kept writing. And eventually I would have published around 11 to 15 papers by the time I applied for IAOMS fellowship. Most of them original articles, maybe 3 were case reports, rest all were proper original studies, retrospective studies in oral cancer patients. That is a time Dr. Moni Kuriakos also guided me a little bit about how to go about with the interviews and all those. And I applied for 2014. I got selected immediately, 2015-16 batch. I was in Shanghai 9 People Hospital. So my area of interest were I was okay with onco surgery, but reconstruction and especially free flaps is something which my institute wasn't doing that much. So that I got the best from the best place in the world. I was with Professor Chitong, and my mentor was Professor Chung. All of them were very supportive. Only problem is you need to learn little bit of Chinese, or there was always one, translator with you always, and they eventually get tired after a while. But it was a great experience. I made lots of friends over there. They had a problem with English. I mean, I had initially problem with English, but they had bigger problem than me. So most of the residents who were trying to get into a proper residency and all, or a proper position into the department, they're supposed to publish over there. So helping them in the weekends, and that's how I could get into the team, get whatever my purpose was over there. That 1 year was very fruitful. Only problem, you have to pick up a little bit of Chinese, and you have to be part of the team. You have to, keep everyone. They will also keep you at right this thing. But even you have to be, because it's your senior resident who is actually giving the input to the professor. Their professors come only for a part of the surgery. You have to be nice with everyone and try to pick up little language and feel comfortable there, make them feel comfortable around you. Because it's after all surgeons are always like a herd. So you have to be part of the herd, unless and otherwise you weren't part, you can't get, the things. After coming back, I joined as a consultant in Kim's Hospital. For 1 year, I was a consultant head and neck oncosurgeon. Then I joined Apollo Hospital. I joined the head and neck team in Apollo Hospital. Currently, I am an independent consultant attached with the ENT department at Apollo Hospital, Hyderabad. Currently, I'm independent, so they just put me under ENT department so that I can get registrars. There is a DNB program in ENT department, so to get assistant surgeons and a little bit of help. It's been nice, all journey. I mean, it wasn't easy, but I knew the path I selected, so I knew that it's not going to be easy either.
Dr. Rui was trying to say that
I've given my 100%.
Yeah. Your commitment is very important right in the beginning, which is what you had, right? You knew what you wanted to do right in the beginning.
Yes. See, I definitely knew what I wanted to do. I wasn't very confident, but the moment I started picking up, then I started growing my confidence levels.
Wonderful.
One step at a time, that's it. So first it was flap raising, next it was neck dissection, next it was reconstruction, next it was the free flap. Small goals, don't overwhelm you in a single.
Thank you so much, Sandhya, for sharing with us your journey. I'm sure it inspired our attendees here, and we'll open the session for question answers towards the end, because as I said, we are really late. We're sitting in front of our screen since 2 hours. Let's go to Wahidul, please. Wahidul? Hi, Wahidul. Assalamu alaikum.
Hello, yeah.
Yeah.
I'll start.
Yes, please. Would you like to introduce yourself?
Yeah, definitely.
I can see a huge introduction here, which is just a part of it.
No, it's all right. Yeah. At first, I introduce myself. I have completed my graduation from Dhaka Dental College. It's in 2004, and after that, I completed my fellowship in Bangladesh. The fellowship is different from the India and other rest of the world. It's a fellowship is a very prestigious postgrad program in Bangladesh, and it is provided by the College of Physicians and Surgeons of Bangladesh. It's a 4 years fellowship program. So I complete my fellowship in 2011. 2010, I have completed my fellowship. And during my 4 years fellowship, I got training in the head and neck plastic surgery, because the fellowship program is designed in this way. But during my fellowship program, I just learned what are the areas of maxillofacial surgery. And in Bangladesh, a lot of, I seen that a lot of cancer patients in Bangladesh and a lot of trauma patients in Bangladesh.
Same in India. In India, Wahidul. We share the geographic location and the problems too.
Yeah. So the problem is that when I during my fellowship training, I observed that I have to learn the reconstruction, because without reconstruction, my primary excision will be compromised. So I always thought I have to be I have to know about the reconstruction. So after completion of my fellowship, I went to my plastic surgery colleagues in Bangladesh to how I can train myself in microvascular surgery, because I'm interested in microvascular surgery. In the meantime, I have been posted in the cancer hospital. One of the cancer hospital in Bangladesh is a 500-bed cancer hospital in Bangladesh. There is also a maxillofacial surgery department. So after posted in there, I have become assistant professor in that time in 2013, and I have met with Dr. Sanjeev Nair. He has come in Bangladesh for a training program. It's a five days training program through the Bangladesh government. And before meeting with the Dr. Sanjeev Nair, I tried to got myself training in microvascular surgery in India and the rest of the world, but I don't get any opportunity. Then I talked with Dr. Sanjeev Nair. Is there any relation with Ganga Hospital? Because I want to go to the Ganga Hospital for microvascular surgery training. So Dr. Sanjeev Nair has given me assurance that yes, definitely I can make the arrangement for you. And he's my mentor, and I love him all the time because he gave me the pathway to be a microvascular surgeon. So I'm always grateful to him, Dr. Sanjeev Nair.
I know, he's an amazing man. Yeah.
Yes, and within
because of him, by the way.
Yeah, within 1 month. Within 1 month, I got the mail from Dr. Sanjeev Nair. He made all these arrangements for training in the Ganga Hospital for microvascular surgery training, and at the same time, he also arranged a cadaver workshop in MS Ramaiah Hospital. And in that time, he sent me to. He told me that one of my trainees or fellow, Dr. Kanan Balaraman, he contact with Kanan Balaraman, and Dr. Kanan Balaraman helps me a lot. I can remember it is 2013. Dr. Kanan Balaraman helps me a lot in Ganga Hospital, and I did my training in the 5 days training in microvascular surgery in Ganga Hospital. It's a fantastic training. This is an Auckland center. You know, there is some of the centers in the world for Auckland, and Ganga Hospital is one of that.
Oh, I didn't know this. Why?
Yeah, so it's a very fantastic training. And after that, I also did a flap raising training in the MS Ramaiah Hospital that is organized by Dr. Sanjeev Nair. And after the completion of this, I returned back to Bangladesh. Then I'm in that time I'm working in the Dhaka Medical College Hospital. Is the largest hospital. Largest hospital in Bangladesh is a 6,000-bed hospital in 6,000-bed hospital, and this is the busiest hospital in the world. You know.
Oh, amazing.
Yes. 20,000 patients come in every day in outpatient department. 20,000. If you go in the morning, you see like a procession. so many people are coming. So I
coming as an observer, Vaidul.
Yes, definitely. And another thing, after getting the flap raising. Sorry. After training the flap raising program in MS Ramaiah Hospital, I thought it before going to operate directly, I have to do a training on the flap cadaver. So in my hospital is a very good source of cadaver, freezing cadaver. So I got the permission from my principal and forensic department. I want to do some cadaver dissection as I am a faculty of here. So they allow me that, and I did myself 30 cadaver dissection in my hospital to how to raise the flap, because it's a freezing cadaver. It's almost mimic like to the what you directly operating. It's like this. So I myself, and also there is my plastic surgery department in my hospital. So they have a microsurgery lab, but in that lab they practice on the not living anything. They practice on the goat head. So I share my concept. So with them, so those who are you are doing this goat's head, it's not very helpful. You have to do it in the rates, living rate. And I have trained myself how to anesthetize living rate from Ganga Hospital, and I purchased some rate from somewhere else and also with my plastic surgery colleague, and I teach them how to give anesthesia to a red and do a microvascular surgery practice on that. So I got this opportunity. I have take this opportunity because they have a very organized microsurgery lab, but they doesn't know how to anesthetize red and how to practice on that. So I got chance and I do my practice on that there. And in that time, I have meet with Professor Ian Taylor. You know the Professor Ian Taylor. He's an Australian microvascular plastic surgeon. He invented the angiosome concept. He visited the plastic surgery department, and I have got an opportunity to work with him, Dr. Ian Taylor. On the bed, he first invented the fibula free flap, and from his concept, we are doing the microvascular surgery. In 1975, in 1975, he first transferred the fibula free flap. So I have an opportunity to work with him in my hospital, and after that, Dr. Sanjeev Nair, I have visited his Mohabir Jain Hospital in Bangalore. So in that time, Anjan and Nair teams doing some microvascular, but not that much. So Dr. Nair feel that I'm interested in microvascular surgery. So he sent me to the Mojumdar Shah Cancer Center, Dr. Moni Abraham Kuriakose. And after going there, Mojumdar Shah Cancer Center, I'm really impressed. A lot of free flaps over there. And Dr. Moni is a legend. And I'm really impressed. One person I have got in the world, the person I can ask to any questions and he give me any questions answers. He's the man, Dr. Moni Abraham Kuriakose. Because I have visited so many hospitals in the world. Dr. Moni Abraham is the person from whom I can ask any question, he can give me the answer. Wow. And with evidence. So Dr. Moni introduced me, give me the opportunity, and I have visited his hospital 3 times, and I have been 1 month, and he gave me, as I'm a little trained in microvascular and other flap raising, and I do some of the regional flaps in my centers. So Dr. Moni, after seeing my presentation, so he impressed about me, and he gave me the opportunity to scrub with him. Though it's an observership, but he gave me the opportunity to work with him. And at the same time, I work with Dr. Novin Hinde and one of the plastic surgeon in Mojumdar Shah, Dr. Shochin Chabre. And I learned from them very submental island flap and some other infrahiat flap, some of the regional flaps, and also the microvascular flaps. And after coming back to Bangladesh, I go to the Tata Hospital. Another person I want to mention here, the Dr. Prathamesh Pai. I am really impressed about his surgery, how meticulously he do the surgery, and excellent surgery. His demonstration and everything is so fine. So I decided to go to the Tata Hospital, and I visited Tata Hospital 3 times for 1 month. And so many microvasculars, also the Prova Yadav, he's a head of the plastic surgery, Prova Yadav. He's also the president of the Indian Plastic Surgery Association. She also helped me a lot to do the microvascular surgery. And after returning from here, I started to work in my hospital. And in 2014, after this Ganga Hospital training and some of the flap raising course in different parts of the world, and I did a 30 case cadaver dissection before transferring the fibula in my center, and I decided the maxillofacial surgery department will not give me the opportunity to do the free flaps. So I got this opportunity to do to the head and neck department, ENT department, because they doesn't know to the free flaps. So I impressed them. I know it. So you give me the opportunity to do that. So they allow me, and I first transferred the free fibula flap in ENT department in my hospital. And successfully the flap was taken, and it was a great day for me. I am very famous in my hospital. This young person, he's doing a lot of free flaps. So after that, I'm getting a lot of opportunity. And I'm frequently doing the free flaps. Some of my flaps are failed, but I don't stop myself. Then I think that I have to go abroad for more experience on this. Then I decided to go to for primary cancer clearance. I saw that for meticulous primary cancer clearance, in sometimes I'm really shaky in some areas during the cancer clearance from the skull base. So I decided I had to train myself on the skull base surgery. So I go to the Singapore, and I got training from Singapore General Hospital under Pisa Almond. Pisa Almond is one of the famous skull base surgeon in the world. And I got training from Pisa Almond about the skull base surgery and how to handle the internal carotid, and also from bleeding from the internal carotid, and how to manage that, how to handle the bleeding from the in infratemporal fossa, foramen ovale or something like this. I got training over there. And in the Singapore hospital, I in one of the conference, onco conference, I meet with the director of the Singapore Cancer Hospital, Professor Tan Hian Kun. So he also see my presentation, and he really impressed about me. You are doing this kind of work in Bangladesh, so you come to my hospital. So I go to the Singapore under the Professor Tan Hian Kun for 15 days, and also got opportunity to work with him, and also scrub in Singapore because he is the director of that hospital. So this way I can got the opportunity to travel different parts of the world and different hospital. And also I got opportunity to work with Subramaniam Iyer in Amrita Hospital in Cochin. Yeah, I have visited in that hospital also. I visited in that hospital.
Anything that you have left, Wahidul? You're a globetrotter along with the cancer surgeries. I think you have finished everything in cancer along with the globe, right? Very interesting.
Yes. And after that, I have one of my mentor. He comes to Bangladesh. He's a Professor Koren. He's a professor of Australia. He's a maxillofacial surgeon. And he's a Koren, Professor Alfred Koren. I have got opportunity to work with him in Bangladesh in one of a workshop, and I worked with him in 2 days, and he loved me a lot, and he gifted me more than 10 lakhs rupees instrument free of cost. A lot of instrument he gifted me after returning back to Australia. And same time, I am trying to contact with the Professor Chen Ping Zhang. He's the director of Shanghai 9 People Hospital in oral and maxillofacial surgeon. He's a very famous oral and maxillofacial surgeons, but I cannot connect with the Professor Chen Ping Zhang. Dr. Alfred Koren make connection with the Professor Chen Ping Zhang. And I have visited to Shanghai 9 People Hospital for 1 month training over there. Professor Chen Ping Zhang has given me the opportunity in Shanghai 9 People Hospital. And after returning from Shanghai 9 People Hospital, I have go to another flap raising programs in Hong Kong, Prince Wales Hospital. Okay. Prince Wales Hospital. There is a 7 days program, 7 days flap raising course, and this is a fantastic course. And after collection, actually, as I'm doing work on the onco surgery and reconstruction in my hospital, because in Bangladesh, a lot of patients, a lot of cancer patients. So I'm just I have some knowledge about that. So I just couple of 1 month's observation is sufficient for me, because I picked the main points how to do it myself. And after returning back to home, I decided to go to the Taiwan.
Okay. I'll have to really stop you because I have 2 more people and they have to finish it.
Okay.
But I can see that your journey is, very interesting, and I have one question, very important one, which I'm going to ask you in the end when we open for question answer sessions. I can, I want to know what would you say the role of luck versus hard work? A lot of people say that this man got lucky, or was it hard work? Because I can see you have seen a lot of centers. I don't think it was luck. Okay. But anyway, if you don't mind, can we please now move up to our next presenter?
No problem. No problem.
Okay.
No problem.
But it was lovely listening to you, and I'm so sorry I had to stop you. I hope you had reached almost the end, right? You are a happy surgeon. You're very well satisfied. You're enjoying your profession. You love what you do, and you do it more because you love more. So that's how it goes. Yeah. Now I would like to request Avni Pandey, Dr. Avni Pandey from Hyderabad, to share her journey with us. Avni, are you there? Avni?
Am I audible, ma'am? Now?
Yes, you are. Yeah.
I'm pretty sure everyone might be tired, so I won't take that much of time of everyone. And
please, Avni, please, let's. I'm sure the ones who are staying back are still interested in listening to you all. So please.
Thing is that, first of all, I want to say that, whenever you're doing fellowship, you should, there is someone who has asked whether you want to love for the subject and the lucky and hard work and all those things. If you do your hard work, you automatically get luckier. So there is no substitute for that whether you're doing your hard work or luck or whatever. And my journey, if I tell you, it's been effortless. It's actually been effortless. And the reason why it was effortless, because I gave my 100% to whatever I was doing. And I was always receptive towards the training. I've always had a faith in my mentor, who is Dr. Ghosla. I'm Dr. Avni because on the screen sharing of Dr. Asmita, my name is not coming. So I would like to introduce myself
to Avni's Avni's slide.
I'm Dr. Avni.
Yes.
I'm working as a chief consultant and deputy director in GSR Institute of Craniofacial Surgery. It's in Hyderabad. It's a cleft center. Thank you, Asmita. So it's a cleft.
And I get so excited to listen you, so that's why I missed it out. I'm sorry.
I love to see your face. I'm actually want you to come to our center and spend some time with us, Asmita. Anyways, coming on to other people, like, my journey has always been effortless because I've always been so much receptive towards my mentor, who is Dr. Ghosla. And I always wanted to be a cleft surgeon. Whenever, during my UG in third year, you have your first interaction with your HODs, they gave your oral surgery lectures. I got so mesmerized by that I had goosebumps then, and I really wanted to be an oral surgeon from then only. Then I did my PG. Of course, PG, you have, limited set of skills you acquire in your PG. And there is a altogether different atmosphere which you get in your PG. And then I wanted to do clefts because I thought that, I'm too emotional to do onco and all. And I always wanted to be a cleft surgeon. And I was so much interested in cleft because during our residency, we used to come to Dr. Ghosla's center for our, residency. Yeah, it's a part of curriculum. So when I saw Dr. Ghosla, doing surgery, and other surgeons also, even in conferences, when I used to see Dr. Krishnamurthy and Dr. Mustafa and all those people, I used to get so mesmerized seeing, the precision what cleft has and the transformation it brings. It actually gave me the purpose in life, I would say. And when I joined, all my dreams got fulfilled in a way because I've never, it's a very stressful work in GSR hospital, let me tell you. All our fellows says that we have normally, 100 surgeries per month, but I never felt tired because I was in love with my work. I always, I even now, even I do even 6 surgeries a day, 7 surgeries a day, I never get tired. Till I'm there in the hospital. When I come home, of course, my husband, says that she is always tired. But till I'm working, I've never been faced this tiredness because I'm so much in like how a painter paints and they never get tired. So I say cleft has become my hobby. It has become my second nature now. So absolutely, if you want to do something, if you're searching for fellowship, always search for something which you actually love, which you actually want to do. Just don't do fellowship shopping that I will do, I don't have anything and I will join somewhere here. After 1.5 years, I will do something else. I will do onco also. Just never do that. whatever you are interested in, give your full heart to that. And one more thing is that always keep your mind open. You should be very much receptive. Some people, they say that, in 1 month of observership, since we have so much of, talent and all, we can learn anything. It doesn't work that way. It's a learning curve. It's not that you can learn anything in 1 month. Even we have some fellows, when we take
Not in 1 year.
Exactly. Even in 1 year, I would say 1.5 years of fellowship is there in GSR in hospital. And some people come for interview, and when we ask them what you expect from here, so what they say is that we want to do craniofacial surgery after passing out from here. And we are like, it's a learning curve. You can't learn everything suddenly. The best thing what I want to tell all those people who are applying for fellowship is that, see, surgery is one thing. Of course, it will come with your own skills, talents, and of course, with gradually. You can't just jump off everything. But the thing, which when you're going for a fellowship, what you should actually consider is that organizational skills, communication skills, and all other leadership skill, and how to communicate with your patients, because fellowship is the only thing which gives the sense, responsibility. It gives a sense of responsibilities, which this responsibility thing is not there in PGs. When you're doing your residency, all your teachers and everyone is there to take care of everything. But in fellowship, it's more or less like a private sector. So the thing is that, how we train or how other people have seen training their fellows is that they instill that belief that to take the responsibility of your patients. Because you are talking to the patient and you're interacting with the patient, not like in how you're interacting in your PG. There you're talking as a student. In fellowship, you're talking as a consultant. So that is something very important, which we should learn. And one more thing I really want to tell everyone is that everyone teaches you how to do surgery. But the main thing which, which has to be learned by the student, they should keep your eyes and ears open, is that how to get the patient convinced by you so that, they can get the surgery done by you.
Yeah,
it's something very important. You can be amazing surgeon, but if nobody's getting is getting ready to get the surgery done by you, it's of no use.
Yeah.
And this is something you should actually, and all these things can come when you're seeing your mentors, when you will see them, when you see them doing counseling, when you see them operating, how they're holding the tissue, what they are doing. Everything you should keep your eyes and ears open during all your fellowship. Every day is a chance to learn. And and apart from your fellowship, you should also go to different centers to see what they are doing, so that you can collaborate everything. I must tell that we are living in a very good era where we have such a great mentors like Dr. Gosla, Dr. Krishnamurti, Dr. Preetham, Dr. Mustafa, there are many people, Dr. Kotra Shetty, who actually wants to teach us. Dr. Sonal, I would say, they actually want to teach us. The era has gone when, I'll tell you, like previous 20 years back, which I hear from, other people's, my senior stories, nobody has taught us, and people were, keeping their works to them.
Very true, yeah.
Now we have amazing mentors and they're ready to teach you. The only thing you need is your dedication. And that's why I say my journey is everyone, to whosoever I have met, they had always taught me. Not because I was some special vibe, because I was interested, I was receptive to them. I've never said, I can't in my dream, I can say that I will just go, 1 month fellowship and 1 month observership and I'll learn clips. I never did that, and I don't expect anyone to do that also. So there is something, everyone has talent. I would say there is, of course, there is nothing like talent. I would say everyone has their own learning curve. Everyone has their own journey. And for women, there is one thing I would really like to say, that, there are women, what they feel is that we should get all the opportunity without putting the efforts. There are few women, because I myself is a woman, I've seen, I have son, I have a wife, I have husband, and all those things. If you want to, compete with the men, you should remove that mindset from yours. Your son is, of course, might be waiting for you, but you have emergency case, you have to attend it. Otherwise, choose some other specialty. But if you have come here once, you can't give this excuse that, because we have some fellows, they come and they say that, no, I have this work, I have that work. It doesn't work. So if you want the equal opportunity with men, you should give the equal input like them.
Fantastic. Well said, Avni. I totally agree with you. Being a woman is not an excuse to not give your 100%. Yeah.
You can't
Definitely not. Yeah.
use it all. And when somebody asks, what are the interview tips? What are the interview tips? Somebody has asked. For them, actually, the thing is that don't do fellowship shopping. Don't do all fellowship things, and make your CV properly. You should have proper publications. You should absolutely have proper publications. Plus, there are a few people who says that we will do onco. If we won't get onco, we will go for cleft. If we won't get cleft, we will go for trauma. If it reflects in your CV, if you'll write that I'm interested in and I'm applying for a cleft fellowship, outrageously we reject such CVs. We don't, because you should be genuinely interested. Only genuinely interested person can give 100% to their work. Otherwise, they can't give. So and if you're so unsure about what you want to do, just, you should go for observership for 2 months or something like that in one department, 2 months in other department. When you're actually sure that this is what I want to do, then only apply for fellowship. Just don't go just because I don't have anything to do and go there.
And waste the time of mentors and yourself too. Yeah. Let's be clear about that.
The first thing is that, we put so much energy in training people. The fellows also, we make them work. Even they waste their 1.5 to 2 years of life. And if they're not able to use that skill goes in air. There is no point in giving those skills to them who can't use them. So
instead, somebody else who really was dedicated could have taken that position and made a benefit of that for himself or herself and the patients.
And you should always aim to become master of one thing rather than, jack of every trade.
Avni?
So,
can we, so you think, I really, your passion and love was amazing.
The MCH, somebody has asked about MCH. I would like to answer on behalf of Dr. Khosla.
Yeah, please do that.
That MCH program is run in AIIMS Rishikesh. All maxillofacial surgeons and even it's open for maxillofacial surgeons and even for plastic surgeons. It's a 4 years program. Actually, again, if you're MDS, then you have to do for 4 years of MCH training. You have to give an exam that is conducted by AIIMS Rishikesh only. The process and everything keeps coming by the AIIMS Rishikesh. You have to give, there is an MCQ exam and then you have to give interview for that.
And oral and maxillofacial surgeons are eligible for this. Yeah. Because initially, I think there was a controversy because how MCH can be,
There was a case going on which has settled now. Now oral and it's open for both oral and maxillofacial surgery and for plastics people.
Wonderful. Yeah.
So it's
okay.
Actually, now even maxillofacial surgeons can be an MCH.
Oh, so we can dream bigger.
Yeah, we can dream bigger and we can be real craniofacial surgeons.
Real craniofacial surgeons. Thanks to Dr. Khosla Reddy.
Thanks to Dr. Khosla.
Yes. Okay, so our next mentee is Dr. Aarti Rao, and after that, we will have 10 to 15 minutes of question answer session with our attendees. Thank you so much for your patience so far and staying with us, whoever is here. Thank you so much for all this. Yeah, I hope you're benefiting from this effort. And here we are with Dr. Aarti Rao.
Hey guys,
hi.
I'm Aarti. Thank you, Ashmita. I'm Aarti. I trained in India, trained essentially in Mangalore and then went on to Dharwad. Now I'm in central Wisconsin in Marshfield Hospitals. I'm an associate physician here. So it was great to listen to everybody. I think this is a great way to have an international forum, and thanks Taranjeet for this opportunity. It's nice to meet you all here. I would like to kind of split up the entire conversation, what we're going to have for the next eight minutes, into starting with my journey as what I went through and where I am and what I am right now, to dividing them into mentoring and as a mentee. So throughout my life, I've been a mentee. From the past 2 years, I've been a mentor. So it's been a nice sweet spot to understand what works and what doesn't work. So starting with my journey, I finished my BDS from AB Shetty in Mangalore. Before that, I was throughout in Chennai. And then I finished my residency from SDM Dharwad in collaboration with Cleft Lip and Palate Smile Train from the Indian branch, the same place as where I trained from. I worked for a year and a half in Srinivas Institute in Mangalore, and that pretty much triggered most of my growth for the reasons that I was the only oral surgeon working there. And then I worked extensively with ENT and plastic surgeons, and we did a lot of collaborative big surgeries, benign tumors, malignant tumors together. And I was training students there as well. So started off as a hospital and went on to a dental school. And what I realized throughout that 1.5 years was everything was great. The work was great. The kind of procedures we were doing was exceptional, helped us a lot, but really there was no growth for the reasons that our concentration was more on taking care of patients. There was no comprehensive care. There was no follow-up. There was no updating. We were just bogged down by a lot of cases. That's when I decided to kind of expand my realm and look into something more, and decided to jump all over again and do BDS in United States, and then get into oral surgery in United States. So I'll tell you, and I understand what the young budding surgeons think about it. I've had my mentors from India tell me that that's a wrong decision to take at this point of time. You're in a good position in your life. You want to kind of continue that. Why are you doing this? But I'll tell you, I agree with Sandhya. There is a lot of uncertainty when you take a big leap, but really, I would encourage people to jump into it. Just do it. Jump into it, feel how it feels. If it doesn't work, what gives? You still have your residency, you still have your program, you still have your passion for oral surgery, you can always get back. But I'll tell you, Elijah, you almost always, you will win, because as long as you have the passion, you will make it through. So that's when I decided to come to United States. Before I came to United States, I worked in Canal Orthodontic Center. He's an orthodontist in Chicago. I know Asmita mentioned it here. Nowhere related to oral surgery, really. I jumped into it, worked with him. I worked as a surgical assistant for him, or rather a dental assistant. So I wanted to learn everything. So I cleaned instruments, I sterilized instruments, I cleaned chairs, I did everything. I worked as an orthodontic assistant after residency in India. But really, that opened my eyes to understand what it takes to run a place. You got to start from below. You got to get to where you are. You got to work from below, and really opened up my eyes as what I want and what I want to do. And I actually came back after my few months in orthodontic center in Illinois. I came back to Srinivas Institute, actually. That's actually before that. So I came back, I worked for 2 years. Then I decided to come back to United States. I understood that you could probably, like how Dr. Rui Fernandez said, you could do your fellowship and then start working as a faculty with limited license, or you could do your DDS program and you have no limitations on your license, and you could be a free bird and practice everything you want under the sun of oral and maxillofacial surgery.
So there was one person who said, "मैं
Okay. Yeah, but that's how I decided to go ahead and retrain myself. So I did my Doctor of Dental Surgery. It's pretty much like a BDS, but it's an advanced training program for 2 years. And I finished that, and my goal entirely throughout that was to get into a residency program in United States. It is hard as an international provider to get into a residency program, but just be focused, just keep moving towards it. And yeah, I did make it to the residency program and University of Minnesota in 2016, and it's a 4-year residency program. And my mentor is Dr. James Swift from United States, and he's been an exceptional mentor throughout, guiding me as what to do and how to go ahead with it. That's what I completed in 2020, and I've been working in a rural central Wisconsin area. It's a Marshfield health system. We work with a lot of Medicare patients. We see a wide scope of oral and maxillofacial surgery patients. I do practice a wide scope of surgery. It starts from, could be just a grade 3 mobile extraction on a patient who is terminal and has many medical complications, to placing zygomatic implants, to taking care of benign and malignant tumors at this point. I refrain from taking care of reconstructive. I could train to do a fellowship and then continue, or I could do it with my training back in India, but really I think fellowship is needed to keep yourselves updated. It's unfair for the patients, but I do a lot of ablative procedures at this point. My focus has been mostly split up into 2 aspects. I take care of a lot of Medicare patients who are marginalized population, low insurance or zero insurance patients. So it's like a walk-in tumor clinic. Patients walk in with a big tumor in their mouth. It's literally that. You wouldn't expect to see that in a developed country, but we do see that. So 40% of my time is with Medicare patients, and 60% of my time is with private part of the hospital, where we place zygomatic implants to routine implants to Botox, cosmetic procedures, lip fillers, and whatnot. So really, it's a wide. Sorry. Oh, okay. So it's really a wide scope of practice I have. I like to play a devil's advocate in every panel, every discussion we have. Yes, it's great to have a fellowship. Yes, it's great to do one particular realm of thing, but it's also important to understand why are we doing what we're doing. Really, I looked at all the conversations we have, all the questions we have. When we trained, we didn't have fellowship as a very well-known option. It was limited. I think Taranjit would relate to that. But now it's a great option. It's open for you guys to kind of look into that. But what I've felt, and again, I speak my heart and mind, Taranjit knows about it. So really, a little bit of disappointment in me is that it's become more like a checklist for the kids in this generation. As I want to finish my residency, get into a fellowship. Yes, but why?
Yes.
You could be competent with whatever you've done in your residency, and you don't need a fellowship. Or if you need more numbers, yes. But really, understanding is why you need a fellowship and what after that. You may get a job in whatever you've done in a fellowship, and you may continue with that, or you may not. And if you don't, what I would like the younger generation to understand is what you've done in your cleft lip and palate training per se, or oncology training, is very much relatable to anything else you do in oral surgery. Now, next week, we have a large fibroosseous dysplasia, which we are going to be resecting out. Yes, I would not have a fellowship on it, but really, whatever we have trained in your fellowship, back in Dharwad, we did a lot of cleft lip and palate. Back in Dharwad, we also had a huge oncology group. What you've learned, what you've trained from that would be something very much relatable to what you're going to do tomorrow. So really, fellowship is more for your numbers, a sheer number to give you that confidence to do more things. Now, when I trained in my residency in India, it was more like look, learn, and once in a while you can feel what it is kind of situation, to be honest with everybody. It's not that you get to run the case, but it's a complete opposite when you train in the United States. As a chief resident, I'm running the clinic, I'm running the show, and I have my faculty watching over me. They do not stop my hand until I'm going to make a crucial mistake. And if they stop my hand when I'm doing a crucial mistake, I would consider it as a huge insult, because you want to be prepared as a student and as a mentee. So that's my journey. And I wanted to talk briefly about it. But talking about mentoring, when I was in my residency program in India, it's more of a stereotype mentoring we were looking for. I need one mentor, one thing to do, and then get going in my life. Really, things change over the years. And when I came to United States, I had nobody to tell me what to do, what not. And there's always a back voice inside you telling you that you've been told by people in India that you might not be successful in this. You really have, and that could be seen as either ways. It could bog you down, it could be a driving force. And now I have great conversations with my mentors in India, Dr. Manjunath Rai, Dr. Padmaraj Hegde. These guys have been great mentors for me. And it's fun to kind of get back in touch with them and talk about things. It's really a small insight as they kind of motivating me to go further with that. But as a mentoring, the things have changed. There's not much of stereotype mentoring. We all look to be mentored by great surgeons, the people who have had made a big name. But really, I wanted to look into something more as a younger generation. There are a lot of other mentors around, which we have to seek for it as a mentee. There could be a mentor who's been doing a lot of cleft and craniofacial surgeries somewhere in Bangalore, but who's not having enough time to be portrayed around, and who's not having enough time to be in conferences. But really, the work they do is outstanding. I, as a mentee, would look to go to them at that point and learn from them. You could learn from pretty much anybody and everybody who's been doing surgery for the longest time. So for me, looking for a mentor is the biggest thing. In mentor, like I said, I was talking about mentoring first. The stereotype mentoring is gone out of the realm right now. Now it's more of like looking for short-term mentorship. I could look for somebody for a month, and I'm like, I could do online mentorship. I could learn from them what their experiences, how they do things. It could be like, I don't need a mentor in orthognathic surgery. I need a mentor in Leaford surgeries. I'll cut it down into smaller segments. I need somebody to teach me how do I do a submandibular approach. All that I need is that. And I would look for mentors who do a lot of facial trauma. I would look for mentors who do a lot of benign pathology. Go learn from them. It's easier. It's more accessible when you break it down like that. So that's something I look for. And then really when I look for mentees, I'm putting a lot of investment in them in terms of my time, in terms of my education. And there's a true metric to see how I have grown in my career is by seeing how my mentees are doing in their life. If my mentees are not taking it forward, it is a disappointment for me, because it's always your teacher who fails you. It's not you. So I take that huge responsibility as a mentor. So for me, understanding what my mentee wants and what they want to go from there is very important. So I do have some baseline expectations from my mentees as well. Like when I saw the questions, most of the questions were pretty much like, what's the course? How many publications do I need? What do I need? And all that stuff. Really, all those are website questions. When you do your ground research, you should have those answers for yourselves. What you look from your mentee is, like I again said, I'm going to be hardcore open to you guys. And I speak my mind only because
truth is important, it's the truth that saves you in the end.
Yeah, because I have the best intentions for you guys, really.
Exactly.
But that's where I come from. That's what I would tell you. Be open, understand what you want from that mentor. Not just that, yes, I want my name with the biggest mentor in the world. No, you need more than that. You need to learn what you want to learn from them. So I would say when I look at my mentees, I have my baseline expectations. Tomorrow, if I have a student coming and telling me, what does it take to become, come and work with you? No, I want you to do that research from your side and then come and ask me other questions. So that's what I'm looking for. So as a mentee, I would say, have a expectation as what you want from this mentor. Have a goal for yourselves. What are you looking for? Am I looking for 1 week being in mentorship, 2 weeks? What are my learning thoughts? What is my end goals from that? Really, those are the few things which are important. Mentorship and mentee is really a true legacy, which we forward it to, and it's a way to future-proof our profession, really. Knowing that we can pass it on to our people, that's very important. And as I always say, one of my well-known professors told me, no, you can learn a lot of things in your life. Your career will always follow you. It will come back to you. Only thing is, always know when to say no to a surgery and when to put up a scalpel. The day your fingers start trembling with old age or whatever, that's the time to pass on the scalpel. And to pass on the scalpel, you need to have good mentees. And to have good mentees, we should have good, well-researched people around. So those are my expectations. And if you have any questions you want to know about how it works and what it works in the United States, please let me know. Although I would like to add one thing to what Dr. Rui Fernandez said. Yes, you can do fellowship in the United States. After fellowship, you can apply for American Board of Oral and Maxillofacial Surgery. It's a board certification program. You can start working with a limited license as a faculty in a program, but really there are a lot of restrictions associated with that. You will always have somebody who's overseeing your work. There are a lot of limitations with that kind of license. So I would say if you're looking for something where you want to kind of really progress in the field of oral surgery, I would recommend doing your Doctor of Dental Surgery, which is a quick 2 years program. When I did it, I really don't have any regrets at this point, because you are pretty much getting back to doing root canal treatments after doing jaw resections. So it's a huge jump, and really takes a while for a body and mind to get adjusted.
Downward jump, rather,
It is. I mean, literally a downward jump, because I would do root canal treatment. I would kind of bust through the root.
Can't even relate to it. After your postgrad, you can't even relate to it. You don't even know.
Right, exactly. But I took it as a 2 year sabbatical. I mean, yes, I did my Doctor of Dental Surgery in University of Minnesota. I made sure that I worked overnight to finish off my quota. We have quota like how we had in India. Finish off my quota, whatever extra time I had, I always spent in oral surgery. I worked as started assisting residents, and then they kind of got their confidence in me and they started letting me do procedures. So even before I could get into my residency, I was almost kind of in their OR working with them. So really keeping it as a stepping stone and helped a lot in that way. But I would recommend doing that because then you have nothing which can stop you from doing oral surgery anywhere in the United States.
Wonderful. Aarti, thank you so much for sharing.
No, anytime.
I'm sure people who are interested have benefited a lot from all the conversations. Sandhya, can we have you too? Where is Sandhya? Has she left? She has a very small child. Asmita, is Sandhya there?
No, ma'am. No, ma'am.
All right. So the forum is now open for question answer session. Do we have any questions for our mentees here? What I understand listening to you all, and I mean, I would like to add some part of my own story. Of course, as Aarti knows, and you know, I'm an old timer, and during my time, there were no fellowships. So we had to really, we didn't know what we want to do. First of all, we didn't know what we want to do. And to find your calling itself is a very big challenge. I'm sure that is the situation even now. Asmita was asking me this question, how do I know which fellowship to choose? You know, that is thinking about your calling. And sometimes the glamour quotient can convert into a calling. You know, somebody's glamour, you see some glamorous surgeon presenting interesting surgeries and you feel that, oh, that is something I want to be like. That is a glamour quotient, but the practical logistical issues with that kind of training may be something else. And once you get into that, you realize that I don't want that. Yeah. But by then, I think it's late. So what Avni was suggesting is a very good idea. Go as an observer to various centers and feel the environment. And I think Dr. Rui also suggested that, you know, go and feel the environment, see how you will, your attitude and your mentor's attitude, the mentor present there, his attitude or her attitude, whether there is a collaboration, because there's so many times you might like, again, it happens in Avni's case, you like the mentor and hence you start liking the specialty. Sometimes that happens, you know, and sometimes what happens is that because of the logistic or the position of your, maybe after, like for example, now Asmita is working in a hospital and she sees a certain kind of cases, which are a lot of them, you know, and then she feels helpless because she doesn't know how to really do justice to that kind of work. Maybe Wahidul had that kind of experience, you know, you see a lot of cancer patients, but you are not trained. So what do you do? And that is when you feel the calling coming for fellowship in cancer. So the fellowship calling can come from any direction. Either you can get it from within you, or it can come from your situation, or from your, or the person whom you have met personally, not in the conference. I would say that please don't listen to the calling that you get from conference glamour quotients, because that will be suddenly a false calling. Yeah. So okay, there's one question for you, Aarti. Only fellowship also requires DDS? If you want to come back to India, I don't think it requires DDS, do you?
No, you don't require a DDS. DDS kind of gives you an independent license to practice in the United States. But also I do, I'm not sure about the intricacies of fellowship. A lot of times if you have to be personally involved in the patient care and be cutting. Really, for me, if you're doing a fellowship, you got to cut. You got to cut no matter what. There's no point in just watching somebody. And you can do, and at least in this day and age, I mean, when I was training, we didn't have much of it, YouTube and all that stuff. Really, at this day and age, you can learn all you want to learn by just watching YouTube videos or any other website videos. All you need to do is cut, hold the scalpel. And for that, I do think there are some restrictions in a fellowship. They might give you a limited license, but I think there might be few restrictions. So there are a lot of concerns with that, but yes, you can do a fellowship in United States and then head back to your own country. But my concern with that, I mean, I understand if you do a cosmetic fellowship in the United States, it's great. I understand if you want to do fellowship in temporomandibular joint resections and reconstructions. We do a lot of temporomandibular joint reconstruction from where I am. That's a good one. But if you're looking for doing a cleft lip and palate fellowship, yes, they do a lot of procedures here. They do a lot of craniofacial procedures. But as a fellow, probably my thought would be to do a fellowship from a place where there's a number of patients, right? The number of patients you get to operate is very important. For example, Dr. Khosla Reddy's fellowship program, that's a great place to be where Avani is, or China is a good place where you, or SDM Dharwad had a number of
place. Vahidul has 6,000 patients coming every day. He says it's like a procession. Yeah.
For oncosurgery. A real fellowship would be in those places because you are learning, you are in it, you're doing it. And then I would say augment it with short-term fellowship in other countries. It's nice to have that, trained in US thing and all that stuff. Really, it doesn't matter end of the day. It doesn't matter. What matters is what kind of care you give, what kind of post-op care you have for your patients, really. So I would highly encourage understanding what you expect from the fellowship, what you want to do, and really look for the place where you'd benefit. If you're looking for a really cool fellowship, I don't know. I don't have an answer for you. If you're looking for where you're working very hard, I think Dr. Vaidul has an answer for that.
He wants to step in, please do.
Actually, everybody wants focus on the fellowship or something like this. That's not an important issue. At first, you completed your post-graduation in maxillofacial surgery. Then you have to skill on in which topic you want to focus on. If you want to be a microvascular surgeon, you have to focus on that. And those centers are based in the world. You have to go that center, and you have to get the lessons from them. Those who are really famous in this field, you have to observe their work, and you have to get the tips from them, and you apply in your center. Then you can skill yourselves. Rather than you complete 6 months fellowship and 1 year fellowship in different parts of the world, that doesn't mean anything, because a lot of people I have seen in my career, they did 2 or 3 fellowships, but they doesn't enough skill to do the surgery. So that's very important issue. So not only focus on the fellowship only, you have to go, if you want to do the cancer surgery, you have to find out which center in the world that deal a lot of cancer patients. They do a lot of microvascular surgery, and what's their strength. And you go that center. You just if you think about me, I didn't do any fellowship elsewhere in the world. I didn't do any fellowship elsewhere in the world, but I am very skilled in microvascular surgery. In last year, I did the 400 neck dissection. You just think it. So because when I feel trouble in my surgery, in doing my surgery, what I feel trouble, I thought I have to learn from anywhere else in the world. Those who are center is really deal with this matter. And I travel that center. I put the techniques from there. I got some tips how to deal this. Then I apply in my center. And in this way, I skill myself.
I have a question for you. I want to know, you said you have been trained in various parts of the world. How did you connect? How did they entertain your applications? Or, I mean, was there a recommendation, or, if I go and mail somebody, will I be allowed just like that?
No.
Yeah, that's an important part of the thing, How did you do that? Yeah. How did you connect with other
yes, I can tell you the tricks how I can make this connection. If you think about just I have a kind of good connection with the Dr. Rui Fernandez, but how I have made this connection, just I give the one answer. In 2017, I have an IO programs in India, and over there is a flap raising course, and I do this course. And in that time, I asked some questions to Rui Fernandez, and I'm sharing my knowledge with Rui Fernandez. And Rui Fernandez impressed about me that this person has an interest and has some knowledge. And I have also presentation in IO about the submental iron flap, reconstruction of artificial defects. And after that, I sent a mail to the Rui Fernandez, and he knows me very well. And then he allowed me to come to his center in Florida, and I visited in 2000.
I'm sorry about this, but my phone is connected.
Just a minute.
Yeah. Please.
Okay.
Sorry.
And from there, I have got, in 2017, I got connection with the Rui Fernandez. And I make a relationship by sending mail to him. And he allowed me in his center in 2019. And the same way in Professor Chen Ping Zhang, Professor Alfred Koron visited my hospital in Bangladesh. I have worked with him. He observed my interest and my skill about this. And then he allowed me to make connection with the Chen Ping Zhang in favor of me. And Chen Ping Zhang has allowed me in his center. So in this way, and actually you have to attend in different conference, international conference in oral and maxillofacial surgery. And also you have to present. Yes, you have to present, because they will know you by your presentation. If they thought about you, you are skilled, you cannot do any harm to his center or his patient, then he allowed you. Otherwise, he doesn't allow you. Because the many center, I got the observationship, but they allowed me to scrub with them. So this is the reason. This way, because conference, workshop in different parts of the world, you'll know the other people, different parts of the world, and make connection with them all the time. And if you connect with them, and then they will allow you to do training over there.
So I understand that this is networking. What you said was networking. The word that we have is networking. It is much easier to do networking through internet now. Earlier we had to travel physical distances, but now because of internet, you and I are connected from various parts of the country and world. And and tomorrow when we meet in a conference, we will know each other already, right? So yes, I think I would like to now end the session, because everybody is tired and people would certainly want to go back to the real world. Thank you so much, all of you. It was an amazing experience. It was an amazing experience for me, even though I'm neither a mentor nor a mentee. And but I'm sure people who attended today's session have benefited from these conversations, which we had from all of you. And we will put this on our YouTube channel. I am not a very technologically, comfortable person, but now I have Asmita with me, so I feel more confident doing all this. So yes, Abhishek, there will be a recording of this soon on this channel called TK Live. Thank you so much, and wishing you all very best in whatever you're doing. Continue to do that and continue to share your light and brighten the world. Thank you.
Thank you, guys.
Thank you.
Bye.
Thank you, Asmita. Good night.
Thank you, ma'am.
Yeah.
Good night.
I hope you enjoyed. Yeah.
Yes, it was a wonderful session. I enjoyed it thoroughly, ma'am.
I enjoyed it too. Yeah. Thank
you. Okay.
Thanks to you. Let me tell you, without you, I would not have managed this. And I have to, I've started believing in God after this. Being an unbeliever, now I'm turning into God. Okay.
Very nice session. It wasn't even expected.
Everybody turned up. 8 people turned up. So I think it was
great.
Yeah. Bye.
Okay. Bye, ma'am. Good night.